everyone. My name is Kara Moncrief and I'm the Clinical Communications Director for Viora. I just want to make sure that you guys can fully see me and I'm not like in a small box with everybody else up. So if you guys would write into the chat, if you're having a hard time just seeing me on your full screen, let us know so we can direct you on how to enlarge myself so you guys can really see the hands-on today. Okay, so we just got someone that wrote in. Let's see, seeing you perfect. Okay, great. So choose speaker view. Thank you, Jade. So all you need to do is on top, choose speaker view so you can see me instead of all the little boxes. Okay, so today's hands-on. I don't know how this is going to go, to be honest with you, because I'm doing it on myself and I'm using the computer as my guide. So hopefully I don't walk away with a bunch of burns. I do have a mirror next to me, and I'm sorry if the camera is a little shaky today. My setup is completely different because it is hands-on, so you guys would actually laugh if you saw this setup. But so sorry if it shakes a bit if I accidentally kick the chair that my computer is sitting on. Okay, so I did have one person write in a question about the pristine. So I'll just quickly cover that and then we'll go straight into hands-on. So with the pristine and how close you can get to the eye, you can do the full eye. So with that small little tip, you can treat under the brow, you can treat the full eyelids. So that really helps with just like makeup going on really smoothly. Plus we a lot of times get just dryness on the eyelids. So you can help with that. And then you go right up to the lash line on the lower eyes and then the crow's feet too. So full eye, you can get as close as you'd like with the pristine. So I hope that helps. Let me just pop off somebody's video here. And if you guys are just joining, all you have to do to enlarge me is click speaker view. All right, and I'm sorry with the machine on, it's not going to be as quiet as it typically is when I'm doing just didactic. So, so sorry about that. Okay, so we're going to get started. What I'm going to start with is the ST, and really, here's the thing. So when we get into IPL, I'm going to try to show you guys hair removal. So I wore like really comfy pants so I could pull it up, and I'm going to try to hike my leg up to show you guys hair removal. So we'll see how that goes. I have poikiloderma on my chest. So I'm going to get pretty close to the camera here when I do my chest. And that's why I'm wearing this today. I kind of look like an astronaut, but it's just easy to move around so I can, you know, really show you guys properly. But you can see I have poikiloderma there on my chest, and I'll explain what poikiloderma is if you missed out on the IPL didactic. So we're going to treat that. I'll show you guys how to treat that. For the ST though, I'm going to treat my neck, and with the V form, we're going to treat the submental area. I'm also going to try to, again, hike up my leg and show you how to hold the larger one like on the legs so you don't lose contact there. So we'll get started with the ST. Your supplies that you need, it's going to be ultrasound gel. By the way, especially if you guys are joining us from overseas, I have been to most of your countries, and I've noticed that a lot of times your ultrasound gel, one, is not clear. So you want to make sure to find a clear ultrasound gel, but two, that it's a bit watery. So I know some countries you just kind of can't help it. You just can't find anything that is really thick. But if you are able to, look for this brand, Aquasonic. It's really thick. If you question, is my gel too thin? Put it in the freezer. If it freezes, there's really a lot of water in it. So ultrasonic is a really nice thick gel, and you really want this for the ST handpiece because the thicker it is, the more comfortable they are. Additionally, the safer it is. By the way, you probably noticed that I have a new mole today that I did not have previously. Here's a makeup trick. If you have a breakout that you cannot cover, make it a mole. Just wanted to explain that. Okay, so tongue depressor. Again, if you guys are joining us from overseas, I sometimes ask, can I have a tongue depressor? And you look at me like, what is a tongue depressor? This is what a tongue depressor is. The reason why we like to use these is because they're nice and thick. so they hold the gel well, and it's really easy to smooth the gel. So if you guys are able to find these, that's the perfect thing to use. Okay, so with the ST, you want a lot of gel. So we say 2 millimeters. If you ever question, do I have enough gel? Just add more. There's nothing wrong with adding too much, but there is something wrong with adding too little. I didn't actually want to go that high. Let's see here. I'm going to use my mirror over here on the side because it's a bit easier. All right. Now we're going to have to avoid the thyroid area. So I'm going to show you guys a trick on how to still treat that skin without actually pulsing on it. This probably would not make riveting TV. Okay, so I'm going to add a bit more, and then I'm going to show you guys how much I added. And that's what's, oh, by the way, I sometimes go to offices. Well, I guess I shouldn't have worn these earrings, huh? Let's see if I can keep them on. I sometimes go to offices where you put your gel. Let me stop somebody's video here. You sometimes put your gel in a jar, and you'll put a lot in a jar. And I don't prefer that. The reason being is it's going to be a lot of wasted gel because you can't, or you don't want to use that same gel that you've been dipping in for another patient. It's just not sanitary. So you end up throwing a lot of gel away, and you have to use so much anyways. So it's a waste. So I recommend to just keep it in the bottle. And all you have to do is just squeeze it out like so. Really nice and easy, sanitary. And see, I'm sitting up, and the thinner gel would just drip down the neck. That's when you really know it's too thin, but this is staying nice and thick. All right, I think these earrings have got to go. I'm going to also grab, so your tools that you want by you. So you're going to want your tongue depressor, your bottle of gel, but additionally gauze. And non-woven 4x4 gauze is the best. So I'm going to show you what that is. So gauze, the reason why we like to use gauze is because when you wipe the electrodes of the handpiece, it's not going to leave any type of like cotton, any type of like material on the actual electrodes. So non-woven means that it's really tightly, pretty much it's tightly woven. And the non-woven gauze is, there's just gaps and holes in it. So that's usually what like they have in the hospitals. And it just doesn't make for great gauze when you're using these devices. Additionally, a 4x4 is great. The 2x2s are a bit small. So when you go in to wipe the electrodes here, it's not so messy. It doesn't get all over your hands. So that's what's great about this. Now, a trick. So we know we have to do typically 6 passes on the area. And sometimes you're chatting with the customer. They love to talk to you. You love to talk to them. You guys are catching up and you're like, oh my goodness, how many passes have I just done? So a trick to that is just laying out 6 pieces of gauze. And you have to wipe the electrodes of the tip after each pass. And the reason for that is a lot of gel is going to accumulate on the tip and it will insulate it, and the tech cooling will go out. Thermal electric cooling. It's the cooling mechanism that allows the treatments to be comfortable because the tips are cold. But if you don't wipe the electrodes, it insulates, the cooling can go out. So really important to wipe the electrodes after each pass. And if you have 6 pieces of gauze, you wipe it, put it over to the side, you can just count how many passes you've done. So it's a nice little trick there. All right, and I like to just lay my tongue depressor down. Oh, another trick, this seems so simple. Try to only use one side of the tongue depressor. If you're using both sides and then you're laying it down on the gauze or towel, wherever you're laying it, it sticks to it and you can't get it off and it just slows you down and it's messy. So try to just use one side. All right, so now I'm gonna pull out the ST handpiece here. And let me log in. Our login is 1234. Nice and easy. Oh shoot, my ST is not plugged in. Give me one moment. All right. right. Now I'm tangled. There we go. All right. So now your modes. Hold on, let me just see chat. RF question, do cell phones need to be off? Image of you on our screen is blurry. Also, should all metal ring necklaces be removed? Sorry, I just got a message that the image of me is blurry. Can somebody write in, is it blurry for everyone? Just let me know that. And then, no, okay, not so bad. No, okay, good. So, so it must just be your computer. I'm not sure how to fix that. And then question of earrings and necklaces, should they be removed? Well, you could see mine needed to be removed because it was sticking to the gel, but not always. Like if they had diamond earrings in and you were to do their neck, it's fine. They can leave their earrings in. But if they're in the way, then yeah. Now IPL, I'm a bit more careful. I have them remove their jewelry just because light can scatter off of that jewelry and you don't want that to happen. But with RF, oops, sorry, if you're doing RF, as long as it's not in the way, it's okay. And then we have another question of cell phones. Do they need to be off? No, it's totally fine to have your cell phones on when you're doing RF. Okay, so the mode that we're choosing. If I were to treat my lower face, because I'm 39, I would be choosing deeper modes because I'm still considered thick skin. So for the lower face, I would be choosing mode 1 and mode 2. On the neck is a tad bit thinner. So I typically will do mode 2 and 3 for thick to medium skin. And then if they have, if they're older and thin skin on the neck, then I would just stick to mode 3. So remember, those modes are like a 3-story building. Picture mode 1 like the first floor of a building, mode 2 like the second floor of a building, mode 3 like the third floor of a building, and then just picture that and drop it into the skin. Where is mode 1 going to be? Always our deepest depth. Where's mode 3 going to be? Always our most superficial. So that's kind of an easy guide because a lot of times we can get it mixed up and think that mode 1 is the most superficial, where it's opposite. Okay, so I'm going to choose mode 2, a bit deeper. And a good starting point, I always start at 42 joules. You can start at 40, you know, it doesn't, you can start at 38 if you want to. But right around 40 joules is where you want to begin. Reason being is when I pulse, I'm going to barely be able to feel it. And I need to titrate up higher than that, though, to actually get a thermal response. But starting at like 20, it just takes a lot longer to get up to that max energy that we need to be at. 40, I can still feel it, but just barely. Now, if I started pulsing myself at 70 joules, then I may jump and say, ah, that's hot. Why? Think of it like getting into a bathtub. If I had scalding hot bathtub and I go to get in it, what am I naturally going to do? I'm going to jump right back out, right? Too hot. But if I get into a lukewarm bathtub and then I add the hot water as I'm in it, now I'm comfortable. We're doing the same thing to the skin. We're starting at a lower energy level, about 40 joules, where I can feel it, but just barely. And then we're going to slowly titrate up to get to the energy that I actually need to be at. So 40 joules is a good starting point. Now your goal is to be at least at 60 or above. So 60 joules is really your goal to actually start creating that heat that you need for that fibroblast cell stimulation. So, and then we'll talk about the energy I end up at and why. Okay, so let me get a bit closer here so I don't burn myself. Okay, so the 4 things you want to think of: put down, good pressure, pulse, then pick up. We're overlapping by 10%, so your pulses, you want them right next to one another. So again, put down, good pressure. Do you see that kind of pressure? It looks like I'm digging into the skin. I somewhat am, but it's tricking the nerve, where if I just barely put this on the tissue and pulsed, that's all I'm going to feel is heat. But if I really use good pressure and then pulse, I feel the pressure so much that the heat sensation goes away. Don't be afraid of your pressure, even when you're treating around the eyes. Don't be afraid of it. Okay, so you're going to pulse 4 to 5 times and then titrate up 10 joules. So I'm going to go to 52 now. And I'm going to pick up right where I left off. And don't lift up before the chirp. Reason being is this is about a 500 millisecond pulse. And if you lift up before the chirp, you're not delivering all of the energy. So either lift up with the chirp if you guys get really good at this and know when the chirp's going to come, or just wait and lift up after. Okay, so now I went to 62, making sure I stay here in the gel. Now I'm starting to feel it a bit more. So I'm going to come up now to my second row. And I'm going to go up 10 more joules because I just pulsed 4 or 5 times. So now I'm at 72. So I'm just going in increments of 10 joules. Now I'm really feeling it. I didn't have much pressure on that one though. Now I'm not really feeling it. So that's the difference between pressure and no pressure. That I either really feel it or I barely feel it. So that's why it's so important. Okay, so now I'm at 72. I was still okay though. Oh, by the way, I forgot to tell you guys something. Once you reach 62, that's when you'll start asking them 1 through 10, how much heat are they feeling? Because if you just ask, are you okay? And they say, yeah, I'm fine. You don't know really how much heat they're truly feeling. So using that scale 0 through 10 or 1 through 10, you can really gauge where they're at. Now, this is bipolar energy, so it's made to be comfortable. And I don't want that strip on me. It's made to be comfortable. So they really should not be above like a 5 heat level. Where I stop, because I keep asking them, after 62 joules, I'll stop and say, 1 through 10, what are you at? And they say, I'm a 1, great. Then you'll titrate up 10 more. Pulse a few times. Now what are you at? Oh, maybe a 2. Okay, great. I'm going to move on. Where I stop is when they start to say they're about a 3 or 4. Because remember, we have to do pass over pass over pass over pass. It's going to keep building more and more and more heat. So towards the end, they will probably end up at about a 5 level. But I was like at a 2, if that. So I'm at 82 now. I'll get a bit closer here. Hope I don't have anything in my nose. I can still barely feel it. Oh, I feel it a bit more right there. But not much. Where I stop titrating up a full 10 joules is when I am at where I'm at now, which is 80 or 82, about the same. 80 to 90 is a huge jump. So instead, now I'm only going to go up by 4s. So if you were at 80, then you'll go to 84. I was at 82, so now I'm going to go to 86. I don't even know where I just left off, so I'll just come back here a bit. Okay, I'm still very comfortable. I'm like a 2. Okay, so I'm going to go up 4 more. Now I'm at 90. Your system can go up to 130 joules, but you're never going to be working that high. You're never really even in the hundreds, rarely. And by the way, remember the importance of hydration before this treatment. Hydrate, hydrate, hydrate. The more hydrated they are, the bigger of a target the RF has to actually be able to get that heat generation and get those fibroblast cells. And when they're dehydrated, they'll really see a lack of result. Okay, so I just got done with that one pass. Now I'm going to pick up my tongue depressor always after every single pass, and I'm going to smooth it. When you're smoothing it, think of it like you're icing a cake. Just that easy. That's it. Just boom, 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 and you should be done. So it should only take 3 or 4 strokes. Well, good thing I didn't wash my hair today. And then you're done. Ooh, I can feel that now on my back. Hold on. Okay, so I did the smoothing. Now what I'm going to do is I'm going to take one of my pieces of gauze and I'm going to show you guys something of all the gel that's accumulated on the tip. If I did not wipe that, that's when I was talking about it will start to insulate it and the tech cooling will go out. So I always wipe it. It doesn't have to be a perfect wipe. Just like what I did is totally fine. Not every piece of it needs to be off. Okay, so now your next pass is you're always going to cross hatch. So you can actually move in the opposite direction. But the main thing you really want to focus on is making sure that you're turning the direction of your electrodes. So I just did a pass, which way did I go? I just did a pass horizontally. Now I'm going to do a pass vertically with my electrodes. I'm actually going to move in the opposite direction too. Oops, so now I'm vertical. Overlapping by 10%. You can see how much pressure I'm using. Now, the second row right underneath the one you just did, my gel's still thick, so I didn't need to add more. You can see the pinkness now coming. And by the way, you know, there's really, with RF, we're not looking necessarily for an endpoint, right? Like with IPL, and by the way, too, you guys, since my hands are full, you guys can keep writing into the chat, absolutely, and I'll get to your questions. But if you want to unmute yourself and just ask them now while I'm doing this, then we can just chat back and forth. Does anybody want to unmute? Okay, so there's not so much like an endpoint. Like, for example, with IPL, we have to work until we get to an endpoint, right? So later when I'm doing my chest with the IPL, I'm going to be looking for changes, right? And that's when I know I've reached my endpoint and I can stop. With RF, it's kind of calculated for you. We tell you how many passes you need to do, what modes you need to do it at, and what joule levels you need to be at. However, if you're at like, I don't know, 60 joules, so very low, and you know, they're maybe saying I'm at a 6, but maybe it was just because they were nervous. And you're not seeing any redness to the skin and they're really not feeling any heat, you're not doing anything. So you have to make sure you're seeing some kind of redness like you're seeing here on my neck. Now, I just thickened it up just by taking the gel off the tip here. So I do that a lot where I just scrape it off with the tongue depressor and then I wipe the electrodes. But if I questioned it right now, if it was too thin, I would add more. Not questioning it yet, we're still good, but I'm gonna make sure to wipe the tip always. Put my piece of gauze over here. Now what we're gonna do, because we already did 2 passes in mode 2, now we're gonna switch it to mode 3. So we're making sure to hit the reticular dermis and the papillary dermis. All right, so now we're gonna crosshatch again. So I'm gonna turn my electrodes now the way I actually began, and I'm gonna come down now. Anybody wanna unmute themselves with questions? I'm at 90 joules and I'm probably at a heat level of, it's starting to build quite a bit. I'm probably at a heat level of like a 3 or 4. So we'll see if I can continue this energy. But instead of turning it down, so if someone goes, ah, that one was hot, before you turn it down, a lot of times it's operator error. And I do it too. So sometimes you're just maybe talking or moving quickly and you lost your pressure. So question yourself before you turn it down. Was my pressure a little light in that area? Was there enough gel in that area? Was I angled properly? So the big thing is making sure that these are nice and flat. If you're angled like this, that's going to be an issue because you're breaking contact of the delivery system. If you're angled like this, oops, sorry, even though it may not arc them, they're going to feel it more and it's going to be more of an intense heat. But when they're nice and flat at that 90-degree angle, they'll be comfortable. So question yourself before you really turn the energy down. If they say, ah, that one was hot, was there enough gel in the area? was my pressure okay? Did I loosen up maybe? And was I angled properly? And I try to test it again. I lost where I was. I try to test it again, and I'll use more pressure. I'll put a bit more gel if I need to, and I'll pulse them a couple more times, and I'll say, is it okay now? And if they say, yeah, now I'm comfortable, okay, it was me. If they say, no, it's still hot, okay, then I just know it's the tissue and I need to take it down a bit. Now, it doesn't mean if you were at, 80 joules to drop it all the way to 60. You were at 80 joules, then just drop it by 4. That will feel night and day different to them, just those 4 joules. And you don't have to take it down too low. Now, oh, what was I gonna say? Shoot. I can't remember what I was gonna say, you guys.
What was the reason you changed modes again?
I'm so happy that somebody joined. So you're adjusting your modes on the neck and the lower face only. If you were to treat like the eyes or forehead, because they're bony, you're always staying very superficial in mode 3, which is our most superficial mode, because it's bony, you can't go any deeper. But for the lower face and neck, it's thicker skin here, so we want to reach both the reticular dermis and the papillary dermis, because both of those layers are made of collagen. So for my neck here, I want to make sure that those first couple passes I reached to the reticular dermis, and then I moved it up more superficial so I can now hit the papillary dermis. So it's the same for the neck and the lower face. If you were to treat like the body or the hands, let's say you're treating the hands, they're also bony, so you would just be in mode 3. If you were to treat the labia, you're typically always staying in mode 3 as well. If you're treating the body like stretch marks and scars, that's when you actually use mode 4, which is a combination of all 3 at the same time. Why? Because stretch marks and scars, they're superficial, right? We don't like the look of them, but when you look at a histological photo of scars and stretch marks, they're also very deep. So we use the combination of all 3 at the same time.
Kara?
Does that help?
Yeah. Kara? Can you?
Yes, I can, but just barely.
Okay. Would you recommend using a water-soluble serum prior to doing this to get penetration better of the product?
You could, but the biggest thing that I recommend actually is the best thing you can do is a microderm beforehand. I did a microderm webinar on Wednesday, and I talked a lot about that because with and I actually microdermed my neck, so I prepped my skin for the ST. And the microderm is going to do a couple things. One, it's going to remove the dead skin cells, so I do have a better depth of penetration with my RF. Additionally, it's increasing blood flow, so it would have been even better if I did it today. It's increasing blood flow to the area, so then our cells have overall just better oxygen and nutrients to respond really well to the RF. So if you were really going to do anything before the ST, really, I'd recommend this always. If you do have a microderm, always microderm them before any treatment, just because there's so many benefits to it. Now, the water aspect, it's just so much better to drink it internally. So our overall, it's not so much because you think about how deep can serums and lotions and moisturizers go? Epidermis. We are not working in the epidermis. We are working in much deeper depths of the tissue. So you're not going to get a huge benefit from it. Now, when they're drinking a lot of water beforehand, their overall internal cells are hydrated. That's when you get the best response. Now, that being said, how much water to drink? If you guys hadn't been on the previous webinars, did I just add more gel? I can't remember. I'll just add more just in case. Usually about the 4th pass is when you're needing to add more gel because you've lost it with wiping it off. And then additionally, not just wiping it off, but because we're using heat, it starts to melt down just a bit. So you always want to make sure it's nice and thick. So I can't remember if I did. Okay, so how much water to tell them to drink is, if you really want to be very precise with it, there's a water calculator that measures their weight and their height and how much water we all should really be drinking every day. So I like to be that precise with it and then let them know in a consultation that I think, yeah, I'm going this way now, that that they should be drinking that every day throughout their whole course of treatment. So it's really important for them to drink at least a liter to a liter and a half of water before every treatment. So it should be done like that morning, that day before their treatment. But the reason why I recommend talking to them in a consultation that they should just be doing that overall every day throughout their course is you're going to have the type of patients that hate to drink water. They never do it. And then they chug that liter of water before they come into your office. Are they really properly hydrated? No, they're still dehydrated. So if you tell them the importance of drinking that amount of water every day, you're really going to ensure that those cells are really properly hydrated when they come in.
Kara, I'm sorry I got on late. So are you really focusing on the overlap, or not so much because you're doing so many passes?
Yeah, you're always focusing on the overlap. If it looks like I'm not, it's because I'm looking at myself on a computer screen.
I just wanted to make sure. Thank you.
For sure. I was just mentioning that because it may not look like I'm doing the best overlap right now. But yes, you're always focusing on your overlap. Heat spreads just a tad, but not like the V form, which I'm going to do next. It has a vacuum. So the heat will really spread with the V form because there's a vacuum component. With the ST, there's no vacuum component. That's why I wore this, so I could move it around. With the ST, there's no vacuum component, so it's very precise. So really the energy is being delivered right where you want it, the depth of it, but also just between those two electrodes. So heat will spread just a tad, but yeah, you want to really focus on your overlap. And that's why we're cross-hatching. That's why we're changing the direction of our electrodes every other pass. That's why we have that really tight 10% overlap. So yeah, absolutely. Okay, I'm going to do one more pass, and then we'll move on to the V form here. And I'll talk about your zone size too, because you can see I'm only doing, oh, and I'll show you how to treat the thyroid area. So your zone size is about the size of a hand. So if I try to do the full neck, when I start here, by the time I got around to here, let's say, the tissue is going to cool. So you want to make sure to split this side of the neck, then this side of the neck, or this side of the face, then this side of the face. By the way, if you're doing the lower face, the first row is typically right above the jaw. Second row typically is right below the lip, but if they have a longer jaw, you could add 3 rows there. But typically it's 1, 2. Third row is typically at the corner of the lip, out. Fourth row starting above the lip. Always stay below the cheekbone because that just gives a beautiful contour to the face. And then you'll finish that pass going down the nasolabial fold, and then you're going to cross hatch it. So you would go down vertically, let's say, it doesn't matter which way you start, but vertically, and then you'll turn them and go horizontally. And that reason why we go down the nasolabial fold twice before that pass is finished is because this is typically where it shows the most signs of aging. Then I would smooth out my gel, then turn the direction of my electrodes, and then do it again. Now, you can move in the opposite direction as I'm doing on the neck, but on the face, I like to go medial to lateral. Reason being is I have points of interest. I have above the jaw, I have the corner of the mouth, I have right below the lip, I have above the lip, staying under the cheekbone. So it just keeps me very organized. I make sure to change the direction of my electrodes though. So that's my preference on the face. On like somewhere like this, it's just a perfect square. I don't have points of interest. It doesn't matter. But that's just my preference on the face. I'll talk about how to do the eyes too. All right, so I cannot remember what direction I was just going, but I'll just do it this way just to show you guys. So I'm gonna get closer here.
Kara, I've found, can you hear me?
I can hear you.
I've found when I treat myself, like especially like around my eyes, it's kind of hard sometimes to get, even with like maximal pressure, it's hard to get up to the 80s. It's really tender in that area sometimes.
For sure, and I agree with you. Actually, since we've had so much time at home, I've been doing a lot of treatments. And it's true. And really the places, and I always point this out, the places that are really sensitive to the, are on the eyes, it's really hard to do high energy right here. So sometimes I will leave that out, just that one, those 2 pulses right there and there, because this over here is a lot more comfortable. So I'll work it to the highest energy I can, here and here, all 6 passes. Then I'll take it down, and then I'll just kind of pulse these 2 areas at a lower energy so they're more comfortable, I'm more comfortable, whoever I'm treating. So that's just I think a helpful trick, just because those are such sensitive areas. Now, the crow's feet, we have so many nerves, the optical nerves here, that this can start to warm up a bit too. So it's okay if you have to have different energies, like above the brow. That's usually very comfortable because it's pretty much the forehead area. So it's okay to have a bit higher energy here, a bit lower energy here on those areas that you know are very tender. Shockingly, when you do the eyelids and below the brow, that's usually not all that uncomfortable. So you can typically keep your energy higher. So it's okay to kind of like space those out. When this is tender, just take your energy down a bit. And I use a ton of pressure around the eyes. I know that sounds like, oh, it's scary to a lot of people, but it's because it is a sensitive area. So the more pressure I have, the more I'm tricking the nerves, the more comfortable they're going to be. Does that help?
Absolutely, thank you.
Yeah, you're welcome. So I'm trying to get really close here so you can see my pressure, because that is key to this. Pressure is going to make sure that you're keeping the electrodes flat, how they should be. And it's so big on tricking the nerve. I mean, I'm at 90 and I've stayed on 90. Not everybody will be that high, but I'm still very comfortable because I have so much pressure. If I lost this pressure, I would probably jump out of the chair. So, you know, pressure really is that important. And then I just want to show you guys that tight overlap, if I can master it here on the computer. And you guys can see the redness. You know, you don't have to question, am I building heat? And that's important for you guys. When you're doing this and you're looking at the skin, you don't want to question, am I building enough heat for this to even work on them? When you see this kind of redness, you don't have to question it. And Joule ranges Joules will range for everybody. So don't think like, I could go 90 on myself, but if I try to treat someone else and they're uncomfortable at 80, so I have to stay at like 78 or 76, that's okay. As long as I'm seeing redness to the skin, maybe their tissue just is responding more dramatically than mine, and they're building heat easier than myself. So that's your gauge. Is there redness to the skin? Can they feel the heat? You want to make sure to talk to them, like, you know, are you feeling this? If they're like, oh yeah, are you still comfortable though? For sure. You know, you want to have that conversation with them, and then be looking at the skin, making sure it is turning red as you're pulsing. Now the redness doesn't always last a long time after the ST, and that's a positive, right? Because there's no downtime to it. So, you know, they walk out of the office and it looks like they haven't had anything done. But yeah, those are the kind of those main things to be thinking of. Okay, so I'll finish the other side of my neck when we're off the webinar, just because you probably don't want to sit and watch me do 6 passes on the other side. And we can move on to a lot of other things here. By the way, this is how I remove the gel. If I just took a piece of gauze and just wiped it off, it's such a mess for you guys. So just like you're shaving, you're just going to scrape it off and then wipe it down. And then it's so much easier for yourself. All right, let me get this cleaned up. I'm going to show you guys how to clean the tip. So I'm actually going to wipe my skin down first. I'm not sticky. Any other questions? You guys can unmute yourself. Wow, I have 13 comments on the chat. Does anybody just want to unmute and ask?
Kara?
Yes.
What are your thoughts about taking it behind the ear?
Totally fine.
Bone?
Yeah, totally fine. It's like if they get crepiness there.
Mm-hmm. Yes.
Yeah, actually we're able to treat earlobes. So earlobes that have been kind of stretched out from heavy earrings, you can actually treat the lobe to tighten the tissue. So yeah, and to do that, by the way, you just would hold a tongue depressor. And now you have a flat surface to pulse on. And then you can do the back end if you'd like, the back side. You can treat all the way back here.
What mode would you do that on?
All three. If you do anything deeper, I've used my thumb sometimes and I can feel it going into my thumb. So make sure to stay more superficial, mode 3. Okay, you guys can keep unmuting yourselves if you'd like. So how to clean the tip is I take a...
Can you hear me?
Yeah, I can hear you. First, I take a dry piece of gauze and wipe that off. Yes, I can hear you.
Okay, sorry, didn't mean to interrupt you.
Oh, you're fine, please do.
Instead of microderm, is it possible to perform like a cool peel, just a light peel?
No, unfortunately not. Yeah, reason being is then now the skin is too sensitive for the treatment. Unfortunately,
Okay.
With microderm, you know, we're just exfoliating, removing the dead skin cells, increasing the circulation, and now we're ready to go with our other treatments. Peeling, no, unfortunately. If you guys don't have a microderm, by the way, we have an amazing microderm. It's called the Pristine. So if it's something that, you know, you've needed within your office, we have a great one. But if you don't have one and you guys do dermaplaning, you can do a dermaplane before your treatments. The reason why I like the microderm over dermaplaning is a microderm takes you 5 minutes. So it's a 5-minute prep instead of a 30-minute prep. Additionally, with the microderm, there's a vacuum, so we increase circulation. With dermaplaning, it's not. So, you know, microderm is always going to be a staple within your office for prepping. But if you do dermaplaning, that's an option.
Great.
Yeah, you're welcome. So what I did is I always, when I'm at offices and I see that they don't have like a spray bottle or a pump of alcohol and it's just like the big bottle, I sometimes will run to Walgreens and get them one of these. It's going to be your best friend because it's easy. You just spray the piece of gauze, don't spray the handpiece, but spray the piece of gauze and you're done. Like, it's just so simple. So this is damp with alcohol. And now I'm gonna, you know, wipe off all the gel. Now, big point is making sure it is cleaned properly. So a lot of times we'll get calls into the corporate office saying, my handpiece is sparking or smoking. And the reason for that is dry gel inside of here. So, and it's sometimes hard to, like, you can't even see it. So make sure, I have nails, so I have an advantage, but I actually take my finger like this in my nail with the gauze though, and I'll come right into the center here, and I'll wipe this side of the electrode really well, and this side of the electrode really well. You don't have to have nails to do this though. And then on the top and on the bottom. So, you know, maintenance of your system is so important because you want these systems to really work properly for you. So making sure to clean them really well is important. So on the top end, on the bottom end, around, and then the full, you know, handpiece, wipe it down, and then you're done. Okay, so now I'm going to show you guys if you were to do the eyes. I usually start on the bottom. It doesn't matter. It's just something I've always done, and it's probably the way we've always trained you guys, so you probably already do that anyways. So it's going to be 2 rows, one right below the lash line, one right underneath that. Sometimes people need 3 rows, but not typically. And you'll take either a piece of gauze or a glove on your hand so you're able to really pull the tissue down. I'm not going to pull on my face right now just because I have Cocktails with Kara on Instagram in a few hours, so I don't want to look crazy. But you pull the skin down. Plus, because I'm younger, I can't get a dramatic pull. When patients are older, you can really pull that tissue down, which is nice because they're the ones that are typically needing a lot of that for the creepiness under their eyes. So you'll really pull, and even on myself, I can get a good pull. I mean, I'm almost 40, so it's not like I have the best skin in the world, but really pull, and then you'll just go right under here, and then cross hatch it. Remember, I like to work medial to lateral, then cross hatch it, and 6 passes. You'll just stay in that one area for 6 passes. Then you'll go to the crow's feet area. I'm Botox, but if they were not Botox, I'll have them smile so you can see where their crow's feet are. If they are Botox like me, you just guess where their crow's feet would be. What's nice about these electrodes is that you can get so close. If you feel on yourself, your bone goes so close to the that orbital ridge protects the eye so well, and so we have a strong bone right there. We always want to make sure that we're pulsing on bone, not on soft tissue like the eyeball. So what's nice about this is that you can get that close. I'm still on bone, and a trick is you can pull it out a bit too, pulse, pick up, and then keep going. So I usually do 3 to 4 rows in this area. So starting about where I left off here, starting about here. So 1, 2, 3, or I'm sorry, 1, 2, do that little trick, 3, and then 4 typically. Males sometimes have crow's feet all the way down into here. So I would have to do a few more rows. Then I move on to above the brow to get the eyebrow lift. So starting in the glabella right here, and then 1 row right above the brow, not on the hair. And then the second row, again, starting in the glabella, and then right above where you just did that first row. So just 1 row right above that. Then I cross hatch it, still working medial to lateral, all 6 passes. Then I move to here, and you're gonna have a glove or piece of gauze, and you're gonna pull this up as high as you can so you're on the bone and off the brow. Then we have a scooping technique that if I were to be sitting, if I were to be laying down and the operator was sitting behind me, this is easy to do, where you push this in. See how I can really get loose skin there? So I'm gonna show you, like, I'll try to show you. I'll show you over here. And you do a scooping technique. Pulse. Pulse. Well, that wasn't good. I'll just show you over here because it's really hard to do this on the computer. Do you see how I'm 1 row below that first row that I just did? So if they have any type of loose skin, the first row you pull, just stay right on the bone. The second row, all this hand does is pushes down the entire time. It doesn't do anything else. And then you're able to create that tissue to easily scoop it up. So that would be your second row. With people with a lot of laxity, you can fit in 3 rows. Yeah, somebody has a question?
Yes, and you're always doing this on a cleansed face, right?
Yes, not on my face. Full makeup. Yeah, making sure they're very clean.
Wonderful, thanks.
Yeah. Now for the lips, if you're doing plump RF, I like to do 4 rows because treating the tissue around the lips is going to be a benefit. As we age, we start to get this downward droop. And if we do a row above the lip out to about here, we are able to lift the corners of the mouth, which is great. Plus any type of fine lines and wrinkles that they may have around the mouth or may have in the future. So it's just nice to do 4 rows. So bottom row, just right below the lip, avoiding my fake mole. Second row, right actually on the lip.
Kara, what usually is the energy level when you're on the lip?
Same as, like, if I were comfortable at 90, let's say on the neck, I may be comfortable with 90 on my lips. So you just don't really know, you know, as long as you're above 60, your goal is always to be above 60. As long as you're there, and they're not jumping off the table and they're comfortable at 80. And I use that technique still where at 60 joules, I'll pulse 4 or 5 times so they can feel it. And I ask them 1 through 10. And if they say I'm a 1, okay, I'll go up to 50 joules. Or I'm sorry, I was at 60, 70 joules. Pulse 4 or 5 more times. What are you at now? 2. All right, great. And then just keep titrating up to find their energy. So really anywhere on the body that you're treating, even though it seems like it's a lot more sensitive in that area, some people are fine in the higher energy levels, shockingly.
And then that's mode 1 for that?
Mode 3.
For the lip?
Yeah, for the lip. And then 4th row, starting right at about the nasolabial fold, because you want the lift at the corner of the mouth. You can go a bit deeper on the skin around the mouth if you need to. So for example, because I have thicker skin, you could technically do mode 1 and 2 around, but the protocol is just staying in mode 3, just so you don't have to keep switching modes constantly, and we're getting great results still. So 4th row, right at the nasolabial fold, right about there, right above the lip. And then top lip is usually thinner than the bottom. So if I can, I'll try to pull it out a bit. But if you straddle the vermilion border, that's fine. So if you can only have it partially on the lip and partially on the skin, totally fine. Sometimes you just need to. So like that. Just try to get it on as much as you can. I would be able to get on my upper lip a lot more if I were laying down and I was properly prepped. The big thing with the lips though, is you need to make sure that you have a 4x4 piece of gauze. This is another reason why the 4x4s are so important, and the non-woven ones are so important, because what you're going to do is you're going to take one piece of 4x4 gauze, you're going to fold it in half lengthwise, and I usually show them how to put it in so then they can do it themselves. If you're a dental office on here, then you can just do it because you're used to doing that, but I usually just show them. So I'm going to show you guys, then I'll explain. So what I did there was, one, I'm making sure that the gel's going to stay out of their mouth because we're using a lot of gel. 2, it helps to dry the wet dry line. So what I'll do once it's in, I'll show you how I pull the lip out. I can get on the lip more because it's kind of like plumped out. So it's helping drying the wet dry line so you can get more of the lip out. So that's what I do before I do the treatment, is I really pull the lips out as much as I can and make sure to tell them really relax their mouth. Some people are trying to do this and keep it closed, and you don't want that. So just relax the mouth, pull the lip out, dry it off, then put the gel on. So it's keeping the gel out of the mouth. It's helping to get the lip out more, but also it's protecting the teeth. So this piece of gauze went right here, so covering my front teeth. And a trick, I guess, is to get it in easy. I use my tongue too. So first I put it here, and then here, and then I use my tongue to kind of push it forward so I can get it in front of my teeth, just to get it in quicker and easier. So you can tell them about that, that little trick. Okay, so any more questions while I'm setting up for the V form?
Hi, Kara.
Oh, hold on one second, sorry, I'm gonna throw this away. I should have brought my trash can closer. Hi.
Hi, how are you? Just one question
Omar.
about modes. Yeah, hi. Modes and parameters, quick for labia correction. Thank you.
Yes, of course. So with the labia, we are doing, you know what? No, it might take too long. I was gonna say maybe I could play the video for the labia, but that might take too long. Okay, so for the labia, we're also using mode 3. Now, sometimes when they have a much thicker labia majora, you could technically go a bit deeper, mode 2. But usually we're always in mode 3. And you're going to split it into sections. So you'll do let's just say you're starting on the left side. You'll start with the left majora. You'll do, I work inward towards the labia minora. So I start out a bit, and I usually just work down and you'll do 3 to 4 rows down, and then you'll cross hatch that. So turning your electrodes, I still work down 3 to 4 rows, then turn it 3 to 4 rows, 6 passes. Then I move to the minora. And with the minora, I take a tongue depressor. Let me grab one. I take a tongue depressor, and then you're able to really lay the minora onto the tongue depressor. So you have a flat surface to pulse on. Otherwise, the minora can just kind of slip, and then you can't really have the electrodes on it. So taking that, putting the labia minora over it, then pulsing, that only takes you a couple minutes to do all 6 passes there. Then I flip the minora over, put the tongue depressor on the side I just did, and then treat the inner minora. I always recommend for everybody's first treatment to just do one side, and then you could have like a mirror like this, and you can hand them a hand mirror and show them the difference, because usually there's a huge difference between the left and the right, and then they get excited like, oh my gosh, this really works. Then I move on to the right side, majora, then minora, and finish it up. And I recommend that for everything that you're doing. If you were just done with the left side of the neck, show them in the mirror the difference in the smoothness of the skin, and maybe like these deeper lines are starting to fade. Just for everybody's first treatment, it doesn't have to be every time. The eye, do one side of the eye or one eye and show them. And usually there's a huge difference. Well, hopefully my eyebrows aren't going to be that high, but you know what I mean? It could be like, oh my gosh, this works so well, I'm so excited. So when they're able to compare one side to the other instead of looking in the mirror after, then it's kind of like, I don't know, I guess I can kind of see something. When you are able to compare the two sides, there's a huge difference. So unless you're doing lips, then it's just hard. And usually with the lips, they sit up and they can really see it. But for everybody's first treatment, that's what I would recommend. All right, so before oh shoot, I forgot to show how to do the thyroid area. Okay, so I usually start with the thyroid area, get that done really quickly, and then move to the left and the right side of the neck. So the reason why I just do this separately is because you really need to pull the skin. So you would put your gel on right where the thyroid area is, and then, oops, I just lost my tongue depressor, and then you pull this as hard as you can pull. It's easier on older clients. You can really pull it over much easier, but you pull this over as hard as you can, get that skin off the thyroid. Now it's over here, and then just treat that really quick. Then you're done with that, wipe off the gel, then do the other sides of the neck. All right, so I'm gonna look at our chat here. Let me scroll up because I had about 18 comments. I just want to make sure not to miss anybody. Okay. I probably already answered that question. Oh, someone answered it for me. Yes, I was still at 90 joules the whole treatment, so I was still comfortable. I don't know if I did 6 passes though. I was talking, I have no idea, but I know I at least did 5 and I was still comfortable at 90. Oh, and you know what, I'll give you guys a guideline. So we know we're starting at about 40 joules, titrating up. And by the way, once I was done with the left side of my neck, when I would go over to the right side of the neck, I would have dropped my joules back down to 40 or 42 and worked up. If I kept it at 90 and I went straight over here and started pulsing at 90, I would have probably jumped and said, it's hot. Why? Just because of that bathtub analogy that I was giving. It would be like me jumping into a scalding hot bathtub. We want to make sure to get the tissue acclimated to that energy. So dropping it back down to whatever side you move to next. Oh, so the Joule range. So you're always starting at about 40, titrating up. Your goal is to be 60 and above. But most people, I want to give you guys a range. Most people fall into, I would say, the very low end that I ever see is about 62 joules. And then the highest range I ever see is at about 94. Even if you could titrate someone up to 100, they're not going to last usually. So that's usually the range. That helps. Oh, thank you, Jade. She answered the question for me. If they have thin skin, do you start and stay at mode 3? Yes. So if I was in my 60s, I would just be in mode 3 the entire time. I would perform and then cool peel prior. Oh, she unmuted herself. Ask that. Oh, can you do microneedling before VST? No. Big no. You can do microneedling after ST though, which is a fantastic treatment. So prepping the skin with microderm, then doing the ST, and then numbing them, and then doing your microneedling. You just can't put heat over that kind of trauma to the skin, which is what microneedling is doing, right? It's like open wounds, but you can't put heat over that. But you can do it the other way around for sure. I usually change out my tongue depressor or put a bit of gel on some gauze so I am not contaminating the bottle after applying to patient skin. That's fine. I don't think you necessarily have to. I mean, this can be wiped down with alcohol, but the way I'm applying it, I really don't think it's going to contaminate. But yeah, because I feel like you'd go through a lot of tongue depressors, but that's fine. Let's see here. What are your thoughts on taking RF behind the ear? Oh, thank you for unmuting yourself. How do you treat the thyroid area? Good, I just showed that. Enzyme, oh, I think she asked that. Are suggested starter settings in the manuals and for each Fitzpatrick type as well? Thank you. Fitzpatrick doesn't matter. Radiofrequency is colorblind, so especially with the ST, there's going to be no difference treating me or treating Indian skin because it's colorblind. In the workbook, the one that I use to go through the didactic, it does not specifically talk about Jowls and what like all those all that information I just gave you about energy. No, so that's why I wanted to give it to you guys here so you know some tips and tricks on how to work with your Jowls. Can you demonstrate thyroid area? Sorry guys, I almost forgot that. Plump RF is one of my faves. Ah, yes, me too. If they have any filler, how long would you wait to do the Plump RF? Any lip filler, so if it's natural based, so the ones that most of us are around anyway, so anything that your body can reabsorb like hyaluronic acid, so your typical Juvederms and Restylane, so on and so forth, you just need to wait 2 weeks. They can withstand very high heat, so you're not going to break them down. Now, anything that's unnatural, like silicone in the lips, you cannot treat because silicone melts down very easily and it will migrate and it's a disaster. So we don't really see silicone much these days, but you know, if you live in a place like maybe South America or Mexico or Miami here in the US, we have to be careful with that because silicone's still used. Would you ever use mode 1 or 2 on face? Yeah, lower face. So for myself, for example, because I am technically under the thicker skin range, I would be doing mode 1 and 2 on my lower face. It's just the neck is thinner. So mode 2 and 3 for younger clientele, and then above 60, mode 3 is the safest. I keep 2x2 gauze in a glass jar full of alcohol to clean my probes, but I love your idea of spraying it on gauze. It's the best. And 4x4s are your best friends, especially when you're cleaning the V form, which I'll show you guys in just a bit. What about threads? No, you have to wait at least 6 weeks. Really, not even, is it 6 weeks? I don't know why I always forget this question. One thing, check with the thread company, and because there's so many different companies out there and different threads out there. So you want to make sure that you're waiting the period that they have dissolved, because you can melt down threads like that. And actually, some of our accounts use it to correct thread issues. So if it was the person putting in the threads and they had some puckering or the thread was inserted too superficial, you can take the ST handpiece and pulse right over it right away, and you can see the puckering just goes away because we can melt the threads down that easily. So that can be used as just a totally off protocol trick. But if they have threads and they're good, you don't want to melt them down. You have to wait until that they have dissolved. So I have to start at 40 joules, then titrate to higher level every time when they come even? I already knew. Oh, yes, great question. So you knew that I was at 90 joules, right? I was fine. Now I come back in 2 weeks later to get my next treatment, start at 40. Just think of that bathtub analogy. If you started me at 90 when I came back in 2 weeks, I'm going to jump off the table. Why? Again, it's just like jumping into a scalding hot bathtub. What am I naturally going to do? I'm going to jump right back out. But if I get into a lukewarm bathtub and add the hot water as I'm in it, now I'm comfortable. We're doing the same thing to the skin. We're just getting the skin acclimated to higher heat temperatures, if that makes sense. Any other questions there? Okay, so what I'm going to do, I actually have to go and grab something really quick for the V form. So what we'll do is we're going to take just a 5-minute bathroom break, not too long. We'll probably take a 10-minute later after the V form. So we'll take about 5 minutes and come right back, and we'll jump into the V form. If you guys have additional questions with the ST or want me to show you something, write in, and I can do that before we jump into the V form. So let me look at the time. It's 6 after the hour. So let's come back 11 after the hour, and we'll do V form. You don't have to jump off because then it's hard to log back in. I can't, no one can see you anyways. And by the way, if you guys joined late and you cannot see me on the full screen, you just need to click on top speaker view. When you click speaker view, then I'll enlarge and you can see better. But yeah, don't log out. None of us can see you anyways. You're all muted, so that's fine. So I've been, oh, still 6 after. Okay, 11 after. I'll see you guys in just a second. Hi. Okay, we're back. It's 11:11 here. The lucky time. Okay, so let me see. I have one person that wrote in. Will it be okay to do RF on someone who has been using Retin-A and used within 2 weeks? No, I wouldn't take the chance. We really recommend with Retin-A just a week off, 5 to 7 days off. So yeah, I would just be really careful with that, just because the skin is so sensitive, especially if they're using higher strength Retin-A or retinol in general, like tretinoin. So yeah, be very careful with that. If they've had like a peel done, they came into you like a med spa type peel, not like a really downtime true peel, then we recommend 2 weeks. So like a Jesmer peel would be 2 weeks. All right, anybody want to unmute? Well, some people are unmuted, but does anybody want to ask a question?
Oh, it doesn't.
Kids are at home. Okay, so I don't think they had a question. All right, so now I have the V form. I'm going to try my hardest to show you on my leg. We'll see how that goes. But first, I'm going to show you the submental area. And you could always include the lower face, which I'm going to show you the movements on that too. So first, I'm going to grab a glove. I always wear gloves with the V form just because it can get very messy. Because you want to get your hands involved. You really want to get your hands down onto the skin to make sure you're not coming off the skin. Because the V form, it's probably one of the most complex to learn in the beginning, to make sure that you really keep contact with the tissue. And when you really get your hands involved, that's when you're going to be successful with it. So I put gloves on just so I don't have glycerin all over me. Anybody can unmute right now, especially while I'm setting up here. Perfect time.
When will the new handpiece come out
Which one?
for the face?
I wish I could show you guys. I don't think I can. I wonder if I can. Let me ask my boss. Let me see if I can text with gloves. Oh, I can. Okay, I just asked her. See if we can, so I can show you guys. So I have it at my house. There was 3 of them sent to the US, one to our KOL doctor, Dr. Rajani, myself, and then one of my our clinical trainers, Heather, who you've probably met on either in person or on the webinar. She's the one that does the practice development ones with me. And she has her own med spa. So the 3 of us have it because we're just, just slowly working with it, testing it, working with the protocols, so on and so forth. So I've been doing my Jowls every 2 weeks. I'm due to have another treatment this Friday, but it's making such a huge improvement in like laxity and buildup of fat in this area. So it's an amazing handpiece. I don't know, your question was, when is it going to come out? I don't know yet, just because of this pandemic. It's kind of slowed the process of that, where it was coming along really quickly. Now it just kind of slowed it down. So I don't have an actual date yet, but I'd love to show you guys if I'm allowed to. Oh, so do tell the new handpiece. So it's called the VFC, and we use this small tip right now for like the lower face and the submental for contouring or for the refit protocol, which is what I'm going to do today, because I do have that laxity there and a buildup of some fatty tissue there. So the refit protocol we're going to do, and I'll walk you guys through that. But the VFC, this was never made to go on the face in general. I mean, you can, it's still comfortable, but for the operator standpoint, it's not that comfortable because it's more bulky. It's made for the body. So we have a very small handheld one for the face, which is really phenomenal. But doing the same protocols, still doing like contouring, still doing refit, just in a very easy way. So yeah, really excited about that. So I'll see if we're able to tell or show, I mean. There's a weird glitch sound. Is someone unmuted? Oh, maybe. Let me mute everybody. Okay, everyone's muted. She just wrote back. Let's see what she said. Oh, nope, I can't. Wah, wah. Coming to you guys soon, though. Okay, so, oh, boo, I know. I thought maybe I wasn't allowed to, so I wanted to double check. Demo, how would treat chest with ST? Never seen this demonstrated. How far to go down on chest, etc. Oh, okay, that's easy. Oh, and by the way, this new handpiece, the VFC, we also have a protocol for a breast lift, so that's going to be exciting. But you can even do that with your ST now in some microneedling. But okay, so for the chest, it's very popular because for us women, we get those bra lines, right? Because we're like this a lot, so we get these lines. You just don't want to go over breast tissue just because it's a precautionary measure, and potentially any type of like cancerous cells that could be there and it could come back on you, so on and so forth. So you just want to avoid breast tissue. All of this does not have breast tissue, so you can go down as far as you need to treat those lines. And then a lot of times I'll just push the breast tissue over and then treat that skin here. But usually our bra lines are like a V starting here in the middle and they V up. So then you're able to just treat all the way down into the center here and then all the way up. And then you can treat the full décolleté too, to kind of lift the breast tissue as well, just not going on the breast tissue. Okay, got a couple more questions. Oh, I love the results of ST on the chest. That's awesome. Yeah, it works really well. So yeah, you can absolutely start doing that. Chest and plump RF, the best ST results. Yeah, Safi. All right, so I'll show you guys the V form. All right, so we're always using glycerin. Always make sure that it's pure glycerin oil. Or not oil, I shouldn't have said that, pure glycerin, because it's not an oil. I've sometimes gone into accounts and they say, our vacuum doesn't sound quite right, or our patients have a lot of burns on them and we don't know why. And I come to find out, I see oil, I've seen vegetable oil, baby oil, jojoba oil, and oils cannot be used because it's RF energy mixed with oil is gonna create blisters on the patient. Plus your filter, your handpiece doesn't know how to filter that out, that kind of oil. So glycerin, it's not an oil. It stays nice and thick on the skin, so you have a nice glide. But always make sure you're ordering 100% vegetable glycerin. Okay, so what I do is I just, from the bottle, I put a little bit there on my hand, and do not use too much, otherwise it's going to clog your V-form filters. It should never be dripping off the patient. It should look like a light sweat on the skin, and that is it. And I just rub it in. Not totally rub it in, but just get it around. And that's it. You can't even really see it. That's how much you need. If it's hard to like move your handpiece, then yeah, add a bit more, but do it slowly at a time because you don't want to mess up your handpiece. All right, so now I take that glove off and then I throw that away. That was my glove to use for glycerin. Let me get another one. I like when you guys ask questions. Any more questions? Makes it nice. All right. So now I'm going to go to V-form. So what we're going to do on me is called the refit protocol. So we have two protocols with the V-form. It's either fat related protocol or tightening of the skin related protocol. So the reason why this works so well on fat and loose skin here and here is because where our fat layer is on our lower face and where our fat layer is on our submental is much more superficial than on the body. So when we do the refit protocol, we're using mode 4 the whole time. So I'm going to remind you guys, mode 4. So 1/3 of that, when we're using mode 4, I'm going to sit back, my back's starting to hurt. When we are using mode 4, 1/3 of the energy is going to mode 1, 1/3 of the energy is going to mode 2, sorry, and 1/3 of the energy is going to mode 3. So we're hitting fat, we're hitting reticular dermis, and we're hitting papillary dermis at the same time. So what that's going to do is it's going to shrink the accumulation of fat here, plus tighten the skin at the same time. That can also be done on the body. If somebody has laxity like post-baby belly, it's going to hit the reticular and papillary dermis the entire treatment protocol. So you're going to be able to tighten the skin really well. The small ones used like above the knees to give a knee lift result. For the knees, what you're doing, see if I can hike my leg up here. So for the knees, what you're doing is, oh, I'm wearing black, that probably wasn't smart. I'm going to roll around here. What I do is, let me try to situate this. So I go just one row here on the side, one row right at the kneecap up, right about there. Second row over, right about there, and then up other way, and then the fourth row starting right about here on the side of the knee up. You don't have to go too far to give a knee lift result. But if somebody has lax, because the inner thighs, because the skin is so thin, you can't, or I'm sorry, I'm losing my train of thought. Because the inner thighs, the skin is so thin, that's where like the arms and the inner thighs start to become lax really sooner than anywhere else because it's thinner skin. So if someone comes in and they have looseness on their knees, but you look and see that they also have a lot of laxity on the inner thighs and the upper legs, just treating that small bit of the upper knee is not going to give them the result that they're needing. So they're going to really need refit on like the inner thigh area and the knee to really lift that tissue. Now, if they're only like my age, 40, 45, something like that, and I don't have that laxity on my inner thighs yet, but maybe I do start to see it above my knees, then you can just do the knee lift result, which is great. Okay, I think that's it for the knees. All right, so let me get situated. Sorry, I'm like all tangled in cords because I hiked my leg up. Again, riveting TV, you guys, riveting. All right, so that was the refit protocol. Now, let's say I was 20 years old and I just put some weight on, and I already have a weak jawline anyways. So if I gain weight, then it becomes even weaker. So for me, if I were 20, I'm not 20, but if I were 20, then you would just want to do the contouring protocol to strengthen my jawline, get rid of my double chin, strengthen all of this here. And I'm 20, so I don't have any loose skin at that point, and that's when you would just want to use the contouring protocol here. Then the contouring protocol is also used to contour any area of the body, the abdomen, the bra fat, the arms, the legs. Cellulite is typically the most popular for the contouring protocol, which is also treating cellulite. So the contouring protocol, we would use a combination of mode 1 for 10 minutes, mode 2 for 2 minutes, then mode 3 for 2 minutes. So remember, mode 1 goes very deep into the fat layer. So that's why we're in that fat layer for 10 minutes when we're doing contouring. But then we also do mode 2 and 3 at the very end of the contouring protocol. And remember, I say remember because I was hoping you guys were on the, I am hoping you guys have been on the webinars in the past where we were doing didactic. So mode 2 is hitting the reticular dermis, mode 3 is hitting the papillary dermis with the V-form handpiece. So why do we do that for 2 minutes and 2 minutes at the end of really targeting fat? Is because what happens when we remove fat in an area, we can get loose skin. So we want to make sure to always avoid that. Let me see the chat here. Is there a protocol for that on the portal? Absolutely. Well, which one? Sorry. Let me know which protocol. Are you talking about the knees? Why use ST and RF on the lower face and neck? Jowls, you answered. Okay. All right. You guys can unmute yourself. I love when you guys unmute yourself so I could just have a chat with you. Yes.
The knee.
Who is it?
Cynthia, the knee.
Hi. Oh, hi. Were you talking about the knees? So not specifically the knees. It's probably something we could create though. It's a good idea. Like where to work. So Donna, our marketing manager, is on here. So her and I can get together and put something together for you guys to put on the customer portal for sure. Okay, so now we're working on the face. Now remember, preheating is always done in mode 4. Why? Because we want all 3 depths going at the same time to preheat very quickly. So I have it set on 4. Now I have an option between RF 1 and 4, or through 4, and vacuum 1 through 4. Be very careful with this one on the face. You do not want to severely bruise somebody. So same with right here where I'm going to treat. So I'm going to put the vacuum, I'll do a 2. I usually like to start with a 2 just so I can preheat quicker, especially now because all of you guys are on. We don't want it to take forever. But if someone bruises easily, if someone has an event to go to, something like that, just stick to vacuum 1 for safety. But also you need to talk to your patients about bruising in general because it is a vacuum. I always say, what would happen if I sucked on your neck? You can hickey, it's a bruise. Same thing, it's a vacuum. So just make sure they know that there's the possibility of bruising so you don't get upset patients if they go home and they're like, this machine bruised me, you didn't tell me about this. You just don't want that to happen. Okay, so I'm gonna do vacuum 2 and I sometimes try out RF3. I can't remember if I'm comfortable with RF3, so I'm gonna do 2 instead. I'm actually going to use the foot pedal with this one. I always use the foot pedal with this one, especially on clients when they're laying down, because if I had a client laying down and I'm trying to hold it like this the whole time, you're going to have major shoulder problems. So instead, you're going to hold it, just wrap your hand around this just like that, and then you can keep your arm down and just use the foot pedal to do it. So I just don't want you guys to have these major arm issues. So now my goal, the biggest importance here is making sure that all 4 of these electrodes stay on my skin at all times. Otherwise I'm gonna arc myself, right? So let me try to scoot up here. Stuck. So many cords around me. Okay, so I'm gonna dig it right into that area. I'm gonna do a couple pulses. A lot of pressure because I want to make sure I'm not coming off the skin. Okay, so I can barely feel 2 pulses. I'm going to go to RF3 because it was really nothing. And that's what you're going to do is talk to your patients about it. Did you feel that much? No. Okay, go up so it doesn't take you forever to preheat. Now it feels warm, so that's what I want. So I'm at vacuum 2, RF3, mode 4. Be careful when you get back here. I usually only do one single pulse instead of a double. So I'm going to come down just a bit. I don't want to come down onto the neck because this one shouldn't be used on the neck. It's too thin here. And I'm just going to come down just a bit more. I like to heat just one side first. And now I'm really starting to feel the heat. So that's good. I probably preheated myself in 2 minutes. Okay, I'm heated, I'm at 40. So remember, your goal is always to maintain temperature between 39 and 42 degrees Celsius. So now I'm gonna heat the other side because the reason why I'm doing the other side too is because this is a small area. So I'll be able to hold heat just fine on both sides. If I were to do the lower face and this area, I would just stick to the left side because that would be 3 rows. 1, 2, 3, typically. But because I'm not doing the lower face and just the submental, I can keep heat on both sides. Do a double pulse. Nope, not there, it's hot. You can feel it. So I usually don't do more than a double pulse on this area just because it's a sensitive area. On the body, it will be different, so I'll talk about that in just a bit. All right, I'm 40 here too, so wonderful. So now, preheated. My vacuum was at 2 with the refit protocol. Now our vacuum always drops to 1. I'm gonna keep the RF level the same. RF3, I was comfortable. It's gonna hold heat easily. And then what I'm gonna do, drop the vacuum to 1, but then I'm gonna set my timer, and I'm gonna set the timer for 14 minutes and hit start. Now, here's a couple techniques you can use. Now I can glide if I'd like. That takes practice. Make sure to not move too slow, otherwise you're really pulsing too many spots in one area and they're going to jump. And make sure not to move too fast because you want still that overlap. So I was just stepping on the foot pedal, holding the foot pedal down and just gliding. This is usually very comfortable for the patient instead of doing like stacked pulses or even like this. That's another technique. You can keep doing either a single pulse if they're getting too warm or a double pulse if they're getting too cool instead of gliding. I usually just do one single pulse there just because it's more sensitive, but I prefer the gliding. Oh, I'll turn off somebody's camera. I think when cameras come on, then you can't see me as large. Okay, opening it up to questions. Does anybody want to unmute themselves?
How do you prevent shocking yourself when you're gliding like that?
Asking myself the same thing right now because I do not have a mirror. I only have this camera. Well, you're not going to shock when you glide because I'm constantly keeping those 4 electrodes on my skin the entire time. And to really ensure that I'm doing that, because I'm doing it not on somebody, which would be a lot easier. I'm not doing it in the mirror, which would be a lot easier. I'm on a camera. So when I'm working on a patient or right now, pressure to make sure that all 4 of those electrodes do not come off the skin. So as long as all 4 electrodes are staying on the skin, you're safe. So I'll show you the pressure I use. A big thing with this handpiece, a lot of people arc someone's face when they first start with this, because this is the IR thermometer. This is what's measuring my temperature right here. And a lot of people, when they go to do the treatment, they try to keep the whole thing on the skin. So they'll do this. And then what happens is they lose contact with this electrode right up here. So always ignore that part. You're only concentrating on this one circle. That's all that matters. Plus, this shouldn't be in the skin anyways. I mean, sometimes you can't avoid it, but this is pulled away a bit so it can measure the temperature properly. So you're just focusing on this circle here. I'm holding the foot pedal down.
What is the temperature of your skin right now?
I stopped to talk, so probably not too high. 39, and it's dropped 38 in some areas.
Okay.
If I kept going, I'd probably be reaching closer to 42, which I would prefer, because when you reach closer to 42, if I drop under a bit, I don't have to worry about dropping under range. So right now, with me only being 39, I'm dropping under 38, right? Because I'm stopping, and you don't want that to happen. I mean, you're not going to be stopping on your patients anyways, but just always focusing towards 42 is important. So I'll see if I can get myself there. Now, one big thing I want to point out, you guys, is that chirp. That chirp is everything for you with this handpiece. If I lifted off before that chirp, that's when I would jump out of this chair. That's when I would potentially arc myself. Because remember, it's not just bipolar energy. With V-form, it's multipolar, right? Multiple electrodes. So you have to give that time for all of the electrodes to fire. And if you lift off before the chirp, you're breaking the contact, and that's when there's a problem. So watch and listen. Now I lift off. Now I can lift off. So keep that in mind. Any questions? I probably won't go too much longer with this one because I'm just wanting to show you, even though I'm really wanting this treatment. But I'll open it up for more questions before we stop, and I'll try to hike my leg up to show you the large one. But look at that pressure I'm using. You're not going to hurt them with pressure. You may run into someone every once in a while that's like, nah, don't use that pressure, but it's so rare. Most people want the pressure. They're like thankful for it. It also makes them feel more secure, like you're more heavy-handed with it. You're not timid with it.
Kara, what do you do for the jowls that are like right underneath the lip line? Just
oh yeah, great question. So
can you use this that you're using now? Just
absolutely.
like right above?
Right above, and that's what I'm typically doing just because I do have those like pre-jowls. I've done about 3 treatments on myself now since we've been at home. So they're getting a lot better, but I still was starting to get them. So what I typically do is I do 1 row below, always below the cheek, because you never want to put this anywhere in the upper face fat, because that's what gives us our youthful appearance, the balls of our cheeks. So starting right about the lip line here and then out, and then you don't want to go on the chin because that's where you lose contact. Plus, we don't jowl there, right? It always starts exactly what you just said at the lip line. It always starts right here. So first row right here, second row starting right about here, right where my fake mole is. This fake mole has actually been an asset today. So starting right where that fake mole is and all the way out. By the way, if you guys weren't on earlier when I was explaining that, you're probably like, what in the world is she talking about? I said, if you guys have a breakout that you cannot cover, just make it into a mole. So first row here, second row right there. And then if they need it, third row right there. Do that for the full 14 minutes and then move to the other side. It's rare that you can really keep heat on both sides unless you have like a really good rolly chair and like hardwood floors in your office so you can roll easily, and then you're rolling back and forth on the patient. But it's hard usually because you're already doing this full area and this full area to keep heat on both sides. Does that help?
Absolutely, thank you.
Yeah, you're welcome. Any other questions before I stop with this one? All right. So let's see if I can get my leg up here and show you guys. This is going to be quite interesting. If I can't, we'll move on to the IPL. A couple questions. Kara, can you explain about wait, hold on. I may have missed one up here. Oh yeah, I did. Okay. What is appropriate interval between RF sessions? Okay, so with the ST, the first one, you can do every 2 weeks for patients that are under 60. You can then do, then you would need to do every 3 to 4 weeks for patients older than 60. And it's just because it takes them longer to heal in general. So when you create that fibroblast stimulation with heat, you want to give them a bit more time for healing. What I'm doing right now, refit, it's also skin tightening. So it would be the same. For me, I could do this every 2 weeks. Patients that are older than 60, you want to space it out a bit longer, every 3 to 4. So if you were treating somebody that had like post-traumatic weight loss and they were 65 and they had loose skin on their arms, you would use this one more so every 4 weeks. With contouring cellulite, what I'm going to show you right now on my leg, if I can, you would do every week. And that's really important for them to stay and make sure that they're able to commit to coming in every week. Reason being with fat, because that's what we're treating. For cellulite, it's fat. For contouring, it's fat. So keeping that metabolism very revved up, because that's what the vacuum and the heat does. It increases circulation, blood flow, therefore increases metabolism. You want to keep that metabolism high throughout the course of treatment, so every week. How many sessions are ideal for face and body contouring? What is maintenance protocol? So for how many sessions are ideal for the face and body contouring? Typically for contouring, it's, 4 on the low end, but I never recommend selling a package of 4. I would more so do a small package of 6 if they have very little fat, and a larger package of 8. For the refit, for tightening, it can be a small package of 6, but it can go all the way up to a large package of 12. So if they have a lot of laxity because of post-traumatic weight loss, then they may need upwards of 12 treatments. What is maintenance protocol? Maintenance is typically 1 for any of these, 1 every 3 to 4 months, because it just falls in line with collagen remodeling and how long it takes for collagen to really rebuild and remodel, and that's about 3 to 4 months. So if they just maintain every 3 to 4 months, it will also maintain their results. Kara, can you explain about Relift protocol? I think it's giving more visible aesthetic results. Okay, so Relift. We have a lot of hand pieces that can treat the lower face. We have the ST, which I just went through, right? So that's for tightening of the lower face. We have this one that we know can, reduce jowls and tighten the skin as well. And then we have another protocol, which is a combination of using this one and the ST handpiece. So when would you choose what protocol over what? Like, do I do Relift? Do I do Refit? Do I just do the ST? Okay, so I'm gonna break that down. So if someone comes in, sorry, let me get rid of this chat so I can see myself, make sure I'm in camera. So if someone comes in wanting just lower face done, you're gonna need to assess them. Is there fat issues? Are there fat issues? Are there laxity issues? Are they really thin? Are they heavier? So you need to assess them to make sure that you are able to customize their treatment plan to them and their needs, right? Because not everyone's going to come in looking the same. So that being said, if it's just lower face issues only, if somebody is older and thin skin and they're just thin in general, they don't have any fat issues, it would just be the ST, because there's no fat issues. But they do have laxity, so you just do the ST for tightening the tissue. Now, if they were young, I'm gonna say 20, 25, something like that, maybe even 30, and it's just fat-related issues, they're too young to have loose skin issues at this point, then it would be this one, but just doing the contouring protocol. Now, they come in and I'll just use me for an example. I'm almost 40, so I'm not young, and I do have the fat issues, but I also am starting to see the laxity. But I'm not too heavy. I know I can lose weight, but I'm not too heavy. So there's not a ton of fat issues there, but there are some. As I'm aging, I'm starting to accumulate that fat here. And because I'm older, I'm also starting to notice that loose skin. So that would be the perfect refit protocol, the one I was just doing on myself. So where that's going to go 1/3 to the fat, so it's going to shrink the fat issue I have there, but 2/3 of the energy is going to go to the dermal collagen layers. So it's also going to tighten at the same time. Now we have another protocol, and that's called Relift. And remember that these webinars are recorded, so you can always go back and watch them to listen to this over and over again, because I know it's probably the most confusing part of learning the systems are all these protocols. So then we have another one called Relift. A Relift is really for a special patient, because most of us fall into needing more of the refit, like me, the jowling, right? The little bit of fat accumulation there, the loose skin here and here, maybe ST on the neck like I did today. But Relift is if you have heavier patients, maybe if I were 20 pounds heavier and with loose skin, because the protocol is doing week 1 contouring with this one, week 2 contouring with this one, week 3 skin tightening with the ST. Then you would do that 2 more times over. So it's a 9-week protocol every week for 9 weeks. So week 1 contouring, week 2 contouring, week 3 ST. Week 4, contouring. Week 5, contouring. Week 6, ST. So you're doing contouring here and here, and then you're doing ST here and here, because when we get older, we also start to have the full neck issue as well. So, you know, you're doing contouring and contouring and then ST. Now, think about how many contours I just said, 6. So that's why I say it's more of for a very specific patient, usually someone that has a bit more fat volume, but also loose skin. So refit really is the most popular because most patients fall into that category, but relift is always an option if they are heavier client, but also needing fat removed and also needing the skin tightening done. All right, let me see my other questions here. Okay, can you do Fitzpatrick? Oh yeah, radiofrequency is colorblind, so you can treat any Fitzpatrick very, very safely. Now, when we talk about VFR next week, that's a bit different because it's ablative, but the ST and V form doesn't matter, it's colorblind, you can treat dark skin types. Multi-volumetric RF. I don't know what that is, Safi, if you want to explain that a bit more. You can see the difference on the side of your face you did ST and refit. Oh, nice. I don't even know if I'm gonna have time today to do the other side. I'll make sure to make time tomorrow on Saturday. Okay. Could you please throw light on fibroblast exhaust syndrome secondary to RF usage? Could you please throw light on fibroblast exhaust syndrome secondary to RF usage? I don't know what that is either, Dr. Simple, if you want to explain that in more detail. So if doing gels also, are you saying you would do 14 minutes on one side, then proceed to 14 minutes on the other side? Yeah, if I couldn't keep heat on both sides at the same time for 14 minutes and I needed to split it, then it would be 14 minutes after preheat, exactly. Okay, if you do V-form on each side of face separately, do you charge patient as one treatment? Oh yeah, you would just charge them as one treatment. And we are doing a practice development webinar tomorrow. Oh God, not tomorrow, sorry. Next week, and we talk a ton about pricing. So hope you guys can join us for next week as well. And remember to find out any dates, it's on VioraOnlineAcademy.com. All right, so Safi and Dr. Simple, if you want to explain those questions in a bit more detail, because I just don't understand. Will I be able to get my leg up here? Maybe. Okay, let's try this. I just want to point out that because these are so much larger, what to do, the tricks to do to not come off the body when using the large V-form tip and the medium V-form tip. On the legs, I usually do the large because my legs are large enough to do the large. So how are you choosing your tip size? Really, it's, I like to use the larger in general just because it, oops, I didn't do it, oh, messed up. Just because, oh wait, what was I saying? I like to do the largest tip if I can on the body because I hold heat so well. I mean, the larger one it's larger, so it has more electrodes and it holds heat really well. So what I do is I'll take the large and I'll kind of map it out. Let me show you. Grab the V-form here. Okay. So here's the large. Now, there's a huge difference in size, right? And there's a huge difference in electrodes. So this one's gonna, if I can make it fit, it's gonna hold on to heat really, where the tissue is gonna hold and build heat really well if I can. So how do I know to use the medium or the large is on the body, I just map it out. So on the leg, for example, if I were to do here, I would make sure, is it gonna fit here? Yes, great. Is it gonna fit here? Yes, great. Is it going to fit here? Yes, great. If I'm trying to do that and I see I'm kind of coming off in areas before I ever begin the treatment, then I say, no, that's not going to work. I can see that I can't really keep contact everywhere I need to, so I'll move to the medium. So places like that are like girls who have thinner legs. A lot of times, okay, it's not an option for the large because they're thin. You would use the medium. Areas like the flanks, sometimes it's challenging to get this to fit, so you'd use the medium. I'm going to use the medium today if I'm even able to do this because I don't want to burn myself and I'm doing something very tricky right now. All right, so here's my white legs. I wore pajama pants so I could do this. I'm going to take some glycerin. Maybe I'll do the bottom part of my legs, that's easier. You typically were really never doing the bottom part of the leg, but I just need an area to like show you guys some of these movements here, and the upper leg is a bit more challenging. Okay, so I have the medium on. So remember, we're always using mode 4 for preheating, so I have it on mode 4. RF, I'm going to put it all the way to 4, and vacuum, I'm going to put it all the way to 4. So when I'm using the V-form on the body, either the medium or the large, this is very easy to do and easy to remember. I do 4 4s. Mode 4, we always have to do that. RF 4, vacuum 4, and 4 stacked pulses. So just a nice little trick to remember. The reason why I do RF 4 and vacuum 4 on most people is because it's comfortable. Like usually they can't feel the heat too strongly. It's not uncomfortable for them. Usually the vacuum isn't really bruising with these large ones. Now, if they are uncomfortable, I'll pulse a couple times to test it for sure. And if it's like, ooh, that heat's too much, okay, take it to RF 3. Or if they say, ooh, that vacuum's too much, okay, take it to vacuum 3. But just remember from the previous webinars, all the positives of the vacuum, the depth of penetration, the circulation, the lymphatics. So many positives to that vacuum. So the higher you keep it, the better off you're going to be. All right, let's not burn me here. I wish I had something to like, I'll just hold my leg like that. Okay, so the biggest thing to remember is 1, will this fit in my treatment area? And I can see that it will. Sorry if the picture is kind of grainy. But then also how you're holding it. So I always use my hand as a tool. I'm never holding it like this. Just this hand doing nothing. I never hold it like this hand way up here. My hand is always down low. So what I mean by that is I'm cupping it, just like this. So my pinky is a guide in feeling the skin. So I make sure that areas I can't see this handpiece, I can feel. So what I always say in trainings is look where you can see, feel where you can't, because these are larger hand pieces. So what I mean by that is if I was treating my leg like this, I can't see down here personally, I can only see up here. So what I would want to do is I would want to look here, make sure it's in contact here, but then have my hand down here to feel, to make sure I don't come off. If I were moving like this, I can see the back end perfectly and I can see I'm on the skin. Okay, no worries. But I can't see what's going on up here. So that's when I would cup it and I could feel if I was coming off or not. So that is such an important, if you feel like you're getting back into the office and you're starting to use the V-form, question yourself, are my hands involved? You need to get down and get in there, and that's why I like to wear gloves. And that's when you're not going to create any arcs on somebody. Let me see if I can rest my leg up. Whoa! Oh my God, what did I do? I stepped on the foot pedal. That scared me. Okay, so let me see if I can rest my leg up here. Let me see if I can turn this bit. Ooh, we're getting somewhere. Not splash my whole body here. Oh my gosh, that is not a pretty picture. My leg looks like I'm a football player right now. Okay, oops, wrong side. This is not easy. Okay, so.
We know you're not a football player, Kara.
Everything looks larger on screen. So I'm going to be feeling here, right, because I can't see. So I'm really you can't see that either. So I'm really feeling around. I do 4 pulses, and then I slide up. And then I slide up. So the reason why I do 4 stacked pulses is because it heats faster. And usually most people are comfortable with that. If you're doing 4 stacked pulses and you still are not building heat, try 5 and make sure it's comfortable for them. They say, no, it's fine. Okay, then do 5 stacked pulses. And then if you're still having a hard time heating them, do 6. Just make sure they're comfortable with it. Try the 6. Are you comfortable? Yeah, it's fine. 6 is really the highest I ever go on somebody, because when you get up higher, then it is uncomfortable. But these are just tricks that you can do to preheat someone quicker if you are having issues. So I'm just going to show you again. Let's see. Maybe that's a better view. So I'm feeling, I'm cupping, I'm holding it just like this, and I'm using my pinky, and I'm really feeling between the actual tip and the skin, and I'm actually feeling around here because I can't see. I'm holding the trigger down, and you don't have to pulse 4 times. Just hold the trigger down, let it release 4, then let off, and then slide up. Oh, my leg's starting to shake, and then let go. Now remember the most important thing, that you're feeling around anywhere you can't see. You're really feeling, making sure you're not losing contact, and you're listening for that chirp. Never lift off until you hear the last chirp, because all of these electrodes are trying to fire. Now that's going to be your protocol. Remember, you're working in the lymphatic direction. So if I were to do like contouring on my legs, I'd be working up towards me like I was towards my heart. What was I going to say? Oh, so that's the technique you'll use, is those stacked pulses. Once you have them heated though, so after you preheat, let's say that I was at 42 or 41 right now, you're not going to be doing that many stacked pulses to maintain my temperature in mode 1. So now we go deep into the fat layer after we preheat. We go to mode 1, we set our timer for 10 minutes, but you're not typically doing 4 stacked pulses, because I'm already 41, 42. So if you do 4 stacked pulses, I'm probably going to jump. Ah, that's hot. So at this point, you're only doing 1 pulse, possibly 2. But remember, you have your temperature gauge. So you're just, you know, as I'm going, I'll see like, oh, this area is 38, like it dropped down. So that's when I would release 4. Then I move up. Okay, this area is 42. I would only release 1. So, you know, you can monitor it as well. Any areas that are dropping under, just release more pulses. Areas that are pretty hot, just release 1. Any questions on that? I'll show you one more time. So I'm going to feel where I can't see. Actually, you can even feel here on the side. So use this finger here. So I'm going to hold it just like this. And I'm going to use this finger to feel between my skin and the handpiece. So I can't see down here personally right now how I'm sitting. I can only see here. So I'm going to cup it just like this with my finger, feel. And I'm going to slide up. And then I would do the next row. Good pressure is going to ensure that you're not going to lose contact too. That's it. Now, let's say I was only doing like 1 or 2 pulses just to maintain temperature. My timer goes off. Now we go to mode 2 and 3. This is at the point where we need a little skin tightening, right? So at that point, you can change your technique if you'd like. You can still do 1, 2 stack pulses, that's fine. Or you can do gliding in the skin tightening mode. So again, I'm still feeling, I still have my hand here feeling where I can't see, but I'm just gonna hold the trigger down and glide. I think the best advice I can give you with this is 3 things. Good pressure is so important to not lose contact, but also for their comfort. 2 is always listen for the chirp. Never lift off until you hear the last chirp. If you're gliding on the skin, that's fine because you're still maintaining contact. But when you actually lift off, take the actual handpiece off the tissue, you have to wait until the last chirp. And the third thing, probably the most important, is look where you can see, feel where you can't. Never question where this applicator is. When you're treating somebody's abdomen and you're working away from yourself, then this front end you can't see a lot of times. So that's when you're holding it like this. Doesn't matter if you can't see, because you're feeling and you're looking at the area that you can see, which would be the back end here, that I'm on that I have contact, but then I'm feeling with my other hand that I also have contact on that opposite end. A lot of times for like cellulite on the back of the legs, I'll hold it like this, because you can use the foot pedal, right? It's easy. So, or these triggers here. So you would hold it like this with the legs, because they're curved. A lot of times if they're a skinny girl and they're curved, so you can feel both sides and make sure that you're not coming off. That makes sense? Is this helpful? I'm questioning myself right now since I don't have a patient to work on. Is this helpful?
Kara, the skin tightening mode is that last like 2 minutes, right?
Last 4 minutes, because you
4
do
minutes.
You do mode 2, which would be the deeper, the reticular dermis for 2 minutes, and then you do mode 3, which would be more into the papillary dermis for 2 minutes. So you're hitting both collagen layers.
Doesn't matter age or laxity.
No.
Okay, great.
Not for body. Or not for this handpiece, I should say. All right, I'm gonna just grab a baby wipe real quick so I can get all this glycerin off of me. Give me a moment here. Okay, I don't have one in here, just give me 1 second, it's around the corner. All right, so any additional V-form questions before we move on to the IPL?
Fitzpatrick contraindications, class 4, 5, 6.
Fitzpatrick? No, we can treat any Fitzpatrick.
Kara?
Yeah.
Can you do face and body at the same time if you have 2 machines? We have 2 machines, B10 and B20, so we could do body and face.
The only thing I've ever heard with that is that the machines can sometimes go out because of all of that energy in one room. Have you done it and had any issues?
No, we haven't done it yet.
So I have heard that people have tried it in the past, but because of all the power that's going on with all the RF energy, that it can create the machines to shut down.
Okay, so I'll try.
Even one of our offices has cool sculpting and Viora. Their cool sculpting was placed too close to the room with their Viora. They were right next to one another and they were on the same wall. Like there was a wall splitting the Viora and the cool sculpting, and it completely powered down their cool sculpting. So I can't see an issue of doing it like on the person, but you could have some complications with that.
What about IPL and V-form?
I would say the same thing. Because the overall power of the systems, that could potentially happen. But I mean, I see where you're coming from. You have 2, so it's, nice that the patient can get in and out, but that could potentially happen, I would say, just because we've heard it before. What was I gonna say about that a bit more? Oh, you reminded me of something. So I sometimes get the question of how many treatments can we do in one day? Can we contour the full body? No, you don't want to do that. You want to stick to 3 areas max. Like what I mean by that is the 2 back of the legs and an abdomen, and then leave it be for the day, because we're really working with the lymphatic system, and you don't want to overwhelm the lymphatic system. I got all this like stuff flying in you can probably see it on camera, and it keeps tickling my nose. But you just don't want to overwhelm the lymphatic system and the body really not be able to break down everything you're doing, but additionally they can get very nauseous after, very dizzy after, and you just don't want that to happen. Now, if it was skin tightening, that's not so much of an issue as it would be when you're really working with lymphatics. All right, let me go into the chat, answer some questions before we move to IPL. I wasn't sure how long this would take. I had no idea. I was just kind of open to it taking 4 hours if we needed it. Let me see what time it is right now. 12. Maybe we'll be done in about 3 hours, but I don't know, might be a bit more. Okay, so let's see. Okay, the V-form technology we called multi-volumetric RF. Oh, since it's the only in the market pulsing the RF from outside and inside. Got it. Called multi-volumetric RF. I like that name. I like that a lot. RF usage on a regular basis may stop showing results, secondary to no response of the fibroblast. Have you witnessed the same? Okay, let me read that again. RF usage on a regular basis may stop showing results, secondary to no response to the fibroblast. Got it. Okay, you're right. And actually, I've seen a huge complication with this, that because we say only do a max of this many treatments and then stop. Because here's the thing, you're using heat for fibroblast stimulation, and if you don't actually stop and give the time for the collagen to really do its thing, then it can become an issue. So, you know, you're only doing so many treatments until it's time to stop. Wait the 3 to 4 months. And remember, you guys, your before and after photos, your after photo is not going to be at their last session. Their after photo is really 3 to 4 months after their last session. So, so you need to give that time for that collagen. So you're absolutely right about that. And additionally, we had a client that forgot about this, and she was treating a bodybuilder, and she had loose skin on her abdomen, and the bodybuilder loved her results, and they just kept going for years. And then there was a huge complication where it almost looked like her skin was not even attached to the body. So you have to be careful with that. It doesn't matter how much the clients love it and they want to come see you every month forever. With RF, you have to be careful. With IPL skin rejuvenation, sure. With RF, you have to be very, very careful with that. Do you prefer foot pedal for body? Not always. Like, I sometimes use the foot pedal. I sometimes use my hands. I preferred it today just because of my situation. Ooh, I forgot to keep that listener. I was like, why am I sticky there? Just because of my situation right now. But a lot of times I do use my hands on the body and use the trigger. I'll hold it, trigger it here, and be feeling here. So it really varies. Now, when I do the face with the V-form and the submental, I never use the hand triggers. I always use the foot pedal because I don't want you guys having shoulder issues by having to hold that piece up like this. I want you to be able to hold it down low, have your hands as a tool down on the skin, and then you have to use the foot pedal so you don't hurt your shoulders over time. That's what's nice about this new handpiece coming out. You're not going to ever have to worry about that. Thank you, the things you do for us. You're welcome. Oh, when I asked, is this helping anybody? You guys wrote in yes. Oh, good. Very helpful. You're doing great, Kara. Thank you. Oh, I got so many yeses. Thank you. You're fabulous. Thank you. You're welcome, you guys. Okay, so what is the difference again between refit and relift modes? My internet kept going out. And do they both use mode 4 first for preheat and then mode 1, 2, and 3? No. So refit is just mode 4 the entire time. Now, to get in more detail on refit, you can always watch the recorded webinar on Viora Online Academy, and it really goes into what the refit protocol is. So I recommend that. But it's using mode 4 the whole time with the V-form. Relift is a combination of using V-form contouring protocol, which is the mode 1, 2, and 3, and then the ST. So it's a combination of using V-form contouring weeks 1 and 2, ST on the lower face and full neck, week 3, and then you just repeat that 2 more times over. When treating back of the legs of V-form, would you treat each leg separately or do all at the same time for 14 minutes? Great question. I'm so glad you asked that because I usually always bring this up. If somebody is thinner, a thin girl with cellulite, then I do both legs at the same time because she's thin and the treatment area is not too large. So I will, if I can keep heat, I will do both legs in 14 minutes, which is awesome. So what I'll do is I'll heat one leg to about 42, then I'll heat the other leg to about 42. Then I'll come back over here, get this one back up to temperature quickly, just like a minute. It takes about a minute. Then I just start my protocol. Take it to mode 1 for 10 minutes. Just keep going back and forth on the legs, which is great. Now, if they have larger legs, then no, I can't do that just because it's too large of a treatment area, or you can't do that because it's too large of a treatment area. But great question. I'm so glad you asked that. Thanks for everything. Oh, you're welcome. I have to leave. Oh, you were great. Thank you so much, Dr. Hill. What is the name of the new handpiece again? It's going to be called VFC for facial contouring. All right. So now we will take our bathroom break before we get into the IPL. So I'm sorry, I'm just looking at the time. Okay, so now we'll take 10 minutes just so you guys can have a quick breather. Grab coffee, water, use the restroom, whatever you need to do. Again, don't sign off just because it's harder to sign back on and all of that. So you can just keep the computer on and come back in 10 minutes and we're gonna do the IPL. We're gonna do the full chest, which is one of the hardest places to treat. We're also going to treat poikiloderma, which is one of the hardest things to treat. So, so this is great that I have it. Unfortunately, I hate it, but it's great that I have it because I'm able to show you the most tricky thing. And then again, I'll try to pull my leg up so I can just show you some hair removal as well. But we'll first start with this. And we'll go from there, see the time and all of that. All right, so it is 13 after, so I'll see you guys at 23 after, and we'll jump in. Okay, see you soon. Okay, let's see what time it is. Okay, it's time. So welcome back. I didn't lose too many people either. Kind of saved the IPL for the end, so you guys would have to stay on with me. I know it's the one that probably most people want to see. Okay, so let's start. Actually, I wanted to start with showing you guys how to clean the V form. I remember that when I stepped away. Let me show you that really quick. I'm gonna sit back for my back's sake. Okay, so again, the spray bottle, it's gonna be your best friend. A piece of 4x4 gauze. I get it very wet. I mean, it's not dripping, but it's saturated for sure because glycerin is so sticky and so hard to get off. So you're really not gonna get the handpiece properly cleaned unless this is very, very damp with alcohol. Then you're just going to go all the way around, right? You want to get the glycerin off the edges here. And then the reason why I get it really damp, again, glycerin's really hard to get off, and I'm able to really get inside here well and clean. So the inside's very important. This is your IR thermometer. You have to make sure to get the glycerin off of that, otherwise it won't read the temperature properly. So really give that a good scrubbing, really deeply inside of here. And when it's wet, it's easy to get in there and really get clean. And remember, alcohol dries so quickly, so it's not going to be an issue. And then I go in at the electrodes on the edges here, in between the electrodes, on the sides of the electrodes. And this is the way you have to do it to get it clean. Otherwise, it's just sticky and a mess. That's it. And it will be perfectly clean if you do it that way. All right, so now we'll get started with the IPL. My IPL is a demo unit. So it is starting to have, it's been moved around to trade shows, to trainings, to anywhere you can think. So it's starting to kind of come loose there. So ignore that. Okay, so first I'm going to show you guys something very, 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 very important, is that you always need to look inside here before any treatment. It's wonderful that we have filters, because in the past, you just slide the filter in here. In the past, it was to get these different wavelengths, you had to have different handpieces. So it would be 6 of these hanging on your wall. So the filters are really nice. However, it's an open cavity. So like the things that you see flying around here in the room, I don't know if you see them, but they're the ones that are tickling my nose. That kind of stuff can get inside here, dust, debris, dirt, anything. So you have to look inside here and make sure it's perfectly clean. If you can see that, it's not. There's some spots inside there. So I need to get those out before I ever use this. Now I'm going to show you the cleaning technique. You don't have to do this before every treatment. You just need to look inside there, make sure it looks perfectly clean before any treatment. If it's not, this is what you need to do. You take a tongue depressor. You take a 4x4. Another reason why you need non-woven 4x4s. I'm really proving that you guys must order these. Spray bottle. You get this damp. Doesn't have to be. It doesn't have to be like dripping wet, like, or not dripping wet, but it doesn't have to be so saturated like cleaning the V form. Just kind of damp. And then I'm going to open this up completely. You can kind of see how wet it is. And then I take my tongue depressor and I'm going to wrap it around kind of like a burrito. Wrap it all the way, making sure to cover the tongue depressor because you don't want to stick any like wood in there, scratch the inside. So I just was really, I don't care about this side, but I was concentrating that it was completely covered on this side. And wrap it tightly, otherwise it won't fit. So now this is just damp with alcohol. Take the dummy filter out. By the way, always put this back when you're done using the IPL. Don't leave your filters in there. Take your filters out, put them in their box for safety, and then pop your little dummy filter in. All right, so you're gonna take this and it fits perfectly inside there. I don't know if you can see that all that well. Let me get closer, further. Let me adjust the lighting here, hold on. There we go. That help? No. You can't see it very well. Sorry, guys. Anyways, it fits inside there. So you'll kind of give it a little scrubbing. Oh, there, you can kind of see it. So I push this forward and scrub the front. Then I push this back and I scrub the back. And then I go sideways. Just to really clean everything out really, really well. And then that's it. And if you have never done this, this will probably be very dirty. You can see. I just broke my mirror. And you will understand why you needed to do this. So now we'll look inside there and we can see it's kind of sparkling clean. Okay, so mine's a dummy handpiece, so it's not all the best. So I'm gonna adjust the lighting so you can see this poikiloderma well. Get my shirt out of the way. I had a hard time. I'm like, what am I going to wear to show you guys this? Okay, so let me play with the lighting really quick. Turn it down. It's such a bummer. I have a professional Canon camera, and there's a way of hooking that up so you guys could see everything perfectly well. And I ordered the piece a month ago, and it's still on back order. You have to have this like certain connection piece. Anyways, it's on back order, and I was pretty bummed just because it would have been a much better picture. I'm gonna try to give you guys the best view here. I mean, it's probably the best I can do here, but you can see, maybe I can get this a bit closer. You can see I have some hypopigment in areas, and that when I move this over, this is my regular skin, and then all of this here, the redness, is the poikiloderma. So poikiloderma, it's where the term redneck came from, because it's exactly that. It's for like men, they get it here on their necks here because their hair is typically short, and the term redneck came from like people working outside, like farmers. And they would work outside and just get beat down on their neck right here. So they would start to get poikiloderma here, where women, we typically get it here on our chest just because of like what I'm wearing right now. And we get a lot of sun here, but we're usually covered because of our hair here. So poikiloderma, it's a mix of broken capillaries, hypopigmentation, and hyperpigmentation. Plus it has more of a rough texture to it. So like when I feel my skin here, it's pretty smooth and soft. Then when I feel here, it's more like rough. Unfortunate, but a lot of us get it. So there's nothing I can do for the hypopigmentation. I've already removed the hyperpigmentation. So the hardest thing really is the vascular component to treat. So now I'm going to be focusing on the redness since there's not much pigment in the area anymore. There is some pigment down here, which I'm going to try to show you guys, but we'll see how this goes. All right. So now what filter to choose for poikiloderma? So remember, if you guys were on the didactic videos, when we talked about vascular pigment, there's two filters that we have, right? We have the 530 and the 580. 580 is good for deeper pigment, deeper vascular, things that are like dense, like melasma or port wine stain, something like that. Where the 530 is great for things like solar lentigo, because typically solar lentigo is superficial, or poikiloderma, or broken capillaries on the face. Broken capillaries, like the tiny ones we get around the nose or on the cheeks, or poikiloderma, those broken capillaries are superficial. So that being said, we will use the 530. Now, before I put the 530 in, I'm going to show you guys something. I'm going to get a piece of gauze here. So the filters come with a soft cloth, like the type of cloth that you use for sunglasses. You can use that, or you can use a piece of gauze, 4x4 nonwoven, another reason to get them. And you're always going to wipe your filter down beforehand because you want to make sure it's nice and clean, just like the inside of the cavity of the handpiece. So you typically don't have to use alcohol on these. Now, if there's a spot that's really hard to get off, use a tiny bit of alcohol and just wipe the little spot and then dry it off with this on the other side. Never get alcohol here. This is your computer chip, so never ever get it there. But you just want to make sure your filters are really spotless before you ever use them. If they're not, and you put them in and your cavity of your handpiece is not clean, that's when you get burns on your filter. And then if it's dirty enough, you can blow out the flash lamp too, which is not good. So we really want to always maintain everything, and cleaning everything is such a huge importance. So don't be lazy with that. Even though sometimes we get done with long treatments and we're like, ugh, it's the last thing I want to do. All right. So filter spotless, inside of the cavity spotless, we're ready to go. So now I'm going to get another tongue depressor here. I would typically be wearing safety glasses, but I won't be able to see anything, so I'm not going to during this webinar. Typically I would for safety though. So instead, I'm just going to blink when I flash, just to make sure I'm still safe. I'm running out of room of where to put stuff here. I already broke my mirror, which I actually needed for this part, but I'll figure it out. Okay, so with the IPL, my skin is clean. I just showered, didn't put any lotion on. Just gonna do that. Oof, it's cutting into me. Just a really thin layer. It's nothing like the ST. A very thin layer is enough unless they are darker skin type. If they're like a skin type 4, 5, or 6, you want to thicken your gel a bit for safety. All right, so let me log in here. Remember, it's 1, 2, 3, 4. I'm going to choose the IPL. I have the 530 filter in, so that's what it recognizes, that it's the 530. So I'm going to hit confirm. Now I'm going to choose my skin type and what I'm treating. So I know I'm a skin type 2. Remember from the practice development webinars, if you haven't joined one, please join us next week. We talk about Fitzpatrick and how important it is for them to take a Fitzpatrick quiz before doing any of these treatments, so you're never guessing their skin type. So I know I'm a 2, so I'm going to select 2. Now it asks, am I treating pigment or vascular? If I have both, because poikiloderma, you usually have both. I just have gotten rid of my pigment. Choose what they have more of. So for poikiloderma, they typically have more vascular. So you choose vascular. Same with the face. If they have a lot of sun damage, pigment, and vascular issues, choose what they have more of first. Okay, so I'm choosing vascular. Please wait for light guide to cool down. It cooled very fast because it's the 530. Remember from the IPL webinar that handpiece cools based on the filter that you put in. 530 doesn't have much cooling because it's superficial, so it cools fast. My pulse configuration, I have an option between single, multiple, and rapid. I'm going to choose single. Why? Because I'm a skin type 2, so it's safe to do so, and I need it for the efficacy of it. It defaulted me, this is a big one, it defaulted me to 16 joules. That would be perfect if I were to do the face. I'm not doing the face though, I'm doing the body. So always, always remember this. If you're treating vascular on the body, yeah, I mean, you're not treating like leg veins, but poikiloderma, or if you're treating any type of pigment on the body, always lower your joules by 4. You don't have to do that for hair removal. It's just when you're treating pigment or vascular, always lower your joules by 4. The 16 may just be too much for the body. Body doesn't respond like the face. The face can take a lot of energy where the body can't take as much. So I'm going to lower that down. Because I know myself and I've done these treatments and I don't want this to take too long, I only lowered it by 2 because I already know I'm going to be much higher than that. But for you guys, don't lower it by 4 because you don't know how their skin's going to respond. I just know that it takes a lot of energy for me to respond. I have the option between 10 and 15 milliseconds. Don't test on the most aggressive, which is 10 milliseconds. I know that I'm going to need a shorter pulse duration because I've cleared a lot of my poikiloderma and now what's left are very tiny, tiny capillaries. But I also have to keep in mind that there's density to them. My whole chest is red. That means I have thousands of broken capillaries in that area. So I have to also keep in mind that they're all going to absorb heat at the same time. So I have to be safe. So I mean, you can even be very safe with testing me at 15. But again, I know my skin and I don't want this to take forever. So I already know I need a short pulse duration for these because I've been treating it for so long and I've gotten to know that point of it. So I'm going to start at 12. But I did lower my joules for safety just because I can't fully remember what I was at last time. Okay, here's what sucks. Oh, the worst is that the IPL is very comfortable when you use a lot of pressure. So with anything I'm treating, I use a ton of pressure and they're usually just fine without any type of numbing cream either. With poikiloderma or anything vascular, you can't use any pressure. It just needs to be touching the skin. And it's because if I use pressure, I'm going to push out the blood source and I'm going to blanch the veins and then there's not going to be a target. So it gets a little bitey when you're treating poikiloderma. So I always just kind of talk to the patients like, if you've had the IPLs in the past, hair removal and skin rejuvenation, it's going to be a bit more bitey this time. Okay, so you probably will see that in my face every once in a while. Okay, so I'm just going to barely put it on my skin here. No pressure. I'm going to close my eyes. That wasn't bad. Overlap by 10%. And I'm going to do 3 spots right next to one another. Now, the reason why I do 3 right next to one another, and immediately I'm going to take off the gel. So the reason why I do 3 right next to one another is because if I just did 1, I'm not going to be able to really look at it and assess it properly with my eyes. So you wouldn't be able to either if you were treating me. And additionally, you have to get my feedback on what it's feeling like. That is the #1 thing with the IPL when you're first testing somebody. Once you get their joules and their pulse duration and you really know their parameters and you have that charted, you don't have to do this whole testing thing again. But their first treatment, you should always add 15 minutes on to everybody's first treatment because you need to take the time. So I just wiped off the gel so I could really feel the sensation. If I had cold gel on there, I wouldn't be able to feel it. So nor would I be able to see it if I didn't wipe off the gel. So wipe off the gel immediately. Now I did 3 so we could really see the response. 1, it would be hard. Secondly, it gives a better idea of what the build on heat is going to be like. Just 1, it's not going to really emulate that. And then lastly is a larger area for me to really be able to feel and give feedback on. So if you were treating me, the first thing you would do right now after waiting 1 to 2 minutes, which we've done, is ask, do you have any lingering sensation? You don't want to ask them right after the pulse. Right after the pulse, they're just going to tell you, what did the pulse feel like? That doesn't matter. That's their pain tolerance. What you want to know is what's lingering. And for me, it's nothing. So it turned a tiny bit pink, but it went away really quickly. Didn't even really turn pink much at all. Went away fast. I don't feel anything lingering. So if you really have no redness, go up by 2. I had a little bit of redness just because it's vascular, but not really much to write home about. So if there's 0 redness, go up by 2 joules. If there's a little bit of redness that's kind of lasting, then only start going up by 1 joule. So there was really nothing that lasted. So I'm going to go up by 2 joules. And now I'm going to test in a different area. You don't want to test over the same area over and over again. You want to find the perfect parameters, right? Try not to fully get undressed here. Okay, so just barely put it on the skin, no pressure at all. I'm overlapping by 10%, I think. I'm going to immediately wipe off the gel. That one definitely was more of a sting. I could feel that one much more. I mean, it's not uncomfortable yet, but there was more of a sting to it. For me, the IPL is not uncomfortable, like at all. The ST, like here, when it's warm, is much more bitey to me than the IPL. But you know, some people disagree and they think it is more of a bitey one. The VFR, I'm going to numb before the hands-on next week for the VFR. The VFR, that's going to be a lot easier to show, by the way. Okay, so now we waited 1 to 2 minutes. And if I were if you were treating me, the first thing you're going to do after a minute or 2 is you're going to ask, do you have any lingering sensation? And I would tell you right now, that I do, it just feels like something's kind of snapped me there. But that's it. Now, what you want to know, what you want to get to is a lingering sensation that has some warmth, some heat to it. So if I say, no, it just kind of feels like someone slapped me, then the second thing I would ask is there any heat with it? And I think, no, there's no heat, then you're safe to go up again. So they'll usually report like a slapping sensation or a tingling sensation. What you want to get to, oh, by the way, when they start to say it's a tingling sensation, you're pretty close, but you need to get to some warmth. And I'll talk about the 1 through 10 warmth when we get there. All right, so I just went up. I think I'll go up 2 joules just because really there's not much going on there. If there was some redness lasting, I would only go up by 1. Be very careful on the chest though. This is the easiest place to burn somebody. Whenever we would get calls into the clinical department with any type of accidental burn, it was usually on the chest. And it was usually because they didn't drop the joules first or take the time to test them like this. So just keep that in mind. If you want to be very safe, then just go up by 1 joule. Nothing wrong with that. Just takes a bit more time. That's it. Okay, so now I'm going to pick a different area. Remember, barely put it. Oh, it's someone saying I'm going in and out. Well, shoot. Hold on a second. Am I fine for me? Oh, I think it's your computer then. Someone just wrote in that it's been fine for them, so it must be your internet. Sorry about that. Okay, so we're gonna just barely put it on the chest. Close my eyes. Overlap by 10%. This is getting more snappy. And do 3 pulses. My skin's very reactive too. So sometimes just if you see some redness, I mean, I could scratch myself right now, like here. I think I scratched myself and it's red. So that's just how my skin is. While we're doing this testing, because we have to wait a minute or 2 between, do you guys want to ask any questions? Unmute yourselves.
Hello, Cara. How are you?
I'm good. How are you?
I'm good. I'm good. It's so good to see you again. I've got used to see you every week now, so I'm checking all the time. What's
good. Yay.
Yes. I have a question.
Yes.
Like most of the time pigmentation, there is like deep dermal and there is epidermal. So could we make in one treatment using both? We're using 580 and 530. And how would we test that? How could we make it safe?
Yeah, so that's a great question. So, so if it were to be mixed dermal, I wouldn't necessarily do both filters in the same day. However, you can do 2 filters in the same day. So when it's something like melasma, for example, when there is a dermal and epidermal component to it, I would more so start safe with the 580, the deeper one, so it's not so aggressive. By the way, my sensation right now is a slight heat. So I just wanted to report that back to you guys. So we'll see after I answer this question what kind of heat I'm feeling. So, what was I talking about? Oh, mixed filters. So if it's something like melasma, dermal and epidermal component, start deeper with the 580. I wouldn't so much use the 530 yet. Now, let's say it's somebody with pigment, plus they just want overall skin rejuvenation. So maybe they just have a little pigment here, but then large pores everywhere else, so they want both. That can be done for sure. So I do that to myself a lot, actually. So do the 580 first for overall skin rejuvenation. Don't go too aggressive where they have too much heat lingering. You just want some very mild redness, them to say very mild heat, like a 1, 2, or 3 heat level, and that's it. Then if it's not too red, I mean, if they have too much redness and too much heat, then no, leave it be. But if it's just slight pinkness to the skin, some slight heat to the skin, then you're safe to go in with the 530 and then hit the pigmented lesions. So start your deeper overall skin rejuvenation with the 580. The 580 may even pull that pigment for you, so you didn't even have to do the 530. But if it didn't, because the pigment's pretty superficial, so you have to get more aggressive with it, then you would use the 530. But if it's a melasma type scenario, I would just focus 580 first, then get more aggressive with the 530 as time goes on.
Thank you so much. No, the question is no, melasma, we have to be very careful, I guess, because we always can have it bouncing back and it's then even more difficult. My question, it was related to sunspots and this kind of things. You know, a lot of them, they are very much superficial. A lot of them, they are dermal. So many times, if you could do it both in a safe way, you could get greater results. I mean,
yeah, for sure. And I always would talk about like sunspots, for example. When you're using the 530, usually it pulls most all of them, sometimes all of them. But then there's sometimes those tricky ones that are deeper. And then you'd switch it to the, so then you'd switch it to the 580 or need to. So yes, since you can use the 580 and the 530 in the same treatment, sure. So do 580, plus it's going to give them skin rejuvenation. Then if there's some that are not darkening quite as well, so some of them will darken with the 580 anyways. But if some of them are just like seeming a bit more stubborn, then pop in the 530 and just hit those.
And if I want to do both, how are we going to do the testing? We will do 3 shots with 580, wait for 5 minutes, and then on top of it, we'll do 3 shots again with 530?
Yeah, I mean, you got to be safe with it. So you would just slowly test with your 580, find your parameter, then move forward. Then if you're going to use the 530 in the same day as well, the 530 is more aggressive, so you're just going to have to slowly test that as well. So the first treatment is going to be a bit longer for sure, but then you have it charted. So when they come back in the next time, you don't have to do any of that. Pop in the 580, you know your energy and pulse duration, do a quick pass, pop in the 530, you know your energy and pulse duration, then hit those pigmented spots that are being stubborn.
Okay, thanks a lot. Thank you. Yeah, and let's assess your chest.
What'd you say?
Let's assess your chest to see what's going on.
Yeah, no, exactly. Okay, so I had some heat. By the way, if you question, is it too much heat in the area? Just feel. If you touch it and it's really hot, then it's probably too much heat. So if they're saying it's getting hotter and hotter, feel it. If it feels really warm to you or hot to you, then be careful. You need to back down from there. So for me, it feels warm to the touch. I had some lingering heat. I would say it was about like a 2 or 3 earlier, and I'd say it's a 1 now. So what I like to do, it's because you question, you have to get to your endpoint, right? So what is my endpoint? It's going to be overall erythema. And if I were just to treat like little capillaries, they're typically going to go from a bright blood red to like a darker coagulated red. But you also want to see like these broken little capillaries on the face. You want to see that they're kind of like angry, that the redness, the erythema is actually surrounding them. With poikiloderma, it's so solid and there's so many broken capillaries, you just want the whole chest to be really nice and red. So do I adjust my Jowls? Do I adjust my pulse duration? Like, what do I do to get to my endpoint? I first always focus on my Jowls. What Joule does it take for my tissue to respond and hold on to heat for? So that's what I'll focus on first. Once I get to the point where, okay, this is holding on to heat, but there's really not a lot of change in the pigment or there's not a lot of change in the capillaries, then I would drop my pulse duration. So that's how I prefer to do it. When I started doing it that way, it really simplified things, and then that's how I teach now too. So let me grab my mirror just to make sure I don't go too aggressive here. It was like a standing mirror, but I broke it. Okay, so let me look. I mean, it actually looks pretty good. It's holding on to redness for sure. So you can see that area, it's holding on to redness, it's holding on to heat right there. But I don't feel much heat, so I'm not quite there yet. You really need it to feel like a mild sunburn sensation. But since it's still pretty red, what I'm going to do now is I'm going to drop that pulse duration just to get a bit more aggressive with them, because those are such tiny capillaries that a lot of times you need to with those. So now I'm going to pick a different area. I'm going to go a little bit lower than I was earlier on this side. And I went down to 11 milliseconds. My shortest is 10, so I'm not quite there yet. I'm just gonna barely put this on the skin. Remember, no pressure with vascular, lots of pressure for everything else. Okay, I'm gonna close my eyes. Okay, so I'm gonna immediately wipe off this gel. Okay, and then we'll wait a minute. So let's look at the chat while we're waiting. Okay, so what are you at with your settings at this point? So right now I'm at single pulse, 18 joules, 11 milliseconds. So the heat builds up. Do you want to, Heather, do you want to write, I don't quite understand your question. If you want to put it in more detail, then I can help you. Can you treat the under eye dark circles with IPL? How close can you get to eyes? I mean, that's hard. I more so recommend RF to thicken the skin so you don't see the dark circles as much. It increases circulation as well, which is good. If you needed to get something like, I have an angioma right here, and I've been wanting to get it, but I'm nervous, right? Even with the Indiag having a small tip to get that close. But they have shields. They're contact lenses that you put in the eye. Doctors' offices use them to treat closer to the eye with lasers. So safely, because then their eye is very, very protected. And the eye, because they have to wear protective eyewear, and you can't get too close with that. So when I'm doing overall skin rejuvenation and I have those protective glasses, you just pull the skin down. So you can treat like crepiness under the eye with IPL. It doesn't work as well as RF, but still, you know, you're rejuvenating the area. Just pull the tissue and then you can get nice and close. But to get really, really close, you typically need those shields. Was somebody gonna ask a question?
Yes. Kara, it's Heather.
Oh, hi.
Hi. I guess my question was, it sounded like the heat was building on the surface after you had pulled the unit away from your skin. Is that
correct? Yep, exactly. So that is why we wait 1 to 2 minutes with testing, because the heat will start to build. So what you see a lot of times is delayed. This is the biggest, probably the most important thing to learn with IPL. What you see is oftentimes delayed. What they feel is pretty immediate. So within a minute or two, the heat is starting to build there. I can feel it, but maybe I'm not seeing a change, a dramatic change. So that's why you're always having to check in with them. How much heat do you feel? Because if you look and go, meh, I don't see anything, and go up, maybe they were feeling some strong heat, and then you look 30 minutes later and they have burns all over themselves. So that's why really taking that time, the heat will start to build a bit. So like right now when I tested, this was like, I don't know, like a 2 maybe. This is more of like a 3 or 4. It's like, it's a heat plus like a sting, like it's stinging, a stinging heat. So even though I may not be able to see a huge change, even in the mirror, because I have that sensation and the patient lets you know, then you know to, okay, this is probably our good parameter. Additionally, you always have to consider the build on heat. So it's different when I just pulse 1 time or do a full row on the chest and all of that heat accumulation together. So always, you know, stay on the safe side, test in 3 spots so it gives you a better idea of what the build on heat is going to be. Listen to your patients, be asking them, always talking with them throughout this testing procedure. And right now, I'm not going to go up anymore. The heat, and always use a number system. They say, yeah, I feel some heat. Find out how much, 1 through 10. And get that number. And I would tell you right now, it's about a 4, possibly 5. So, okay, you don't want it to be a 6, 7, 8, 9, 10. By the way, if they do report something like that, make sure to have ice packs nearby because you want to start icing it. You want hydrocortisone near you to pop on some hydrocortisone. After I'm done with my chest, I'm going to put hydrocortisone on anyways. Oh, I was telling you guys this on the webinar, the IPL didactic webinar, that if you guys live here in the States, if you have CVS Pharmacy, they sell these. They're amazing. Sorry, it's all beat up, but these little hydrocortisone packets. So I travel with these to like our Viora academies because it's easy. I just can open up one for the patient. I love it. So when we're done with my chest, I'm going to immediately put this on. And what this does, it's a topical steroid, is that it will take the heat down right away because I don't want it to keep getting warmer, and that's what can happen. So I want it to stay like the sensation I have now, not anymore. So it really calms it. I'm gonna 100% ice my chest after as well. I'm very careful with the IPL, not hair removal, not acne, but when you're doing pigment, vascular, and skin rejuvenation, I always like to ice after for safety, just for, you know, nothing may be wrong, but just to really start to calm the skin because you've already done so much, you don't want it to keep getting warmer. If you accidentally burn someone, just always make sure that you have Silvadene. It is a prescription, so you know, a nurse practitioner, PA, doctor would need to call it in, but it's very safe to have Silvadene in your office. It's a silver, and it's a medical burn cream, so it can stop a first-degree burn turning into a second-degree burn, or it can even stop it from turning into even a first-degree burn. So that's really nice to have. It's not something you need to use often, by no means, but if you're like, ooh, that looks too aggressive, then use it. Okay, so we're gonna stay here. I'm gonna show you now, I'm gonna cover the full area. The reason why subpoikiloderma is kind of scary to treat is because our endpoint is redness. So this is gonna be redness on top of a lot of redness. So many times with poikiloderma, you look at them and go, oh, for sure I've burned them, for sure. But in the beginning, but just be, you know, remember this time that I was talking about, that it's just redness on top of a lot of already red area. So, you know, just feel it or ask them, is there a lot of heat? And they're like, no, you know, believe them because they would let you know if it was a lot of heat. Also feel the area. Does it feel really hot? No, like right now, this is still stinging and warm, but I'll feel it and I don't really feel much heat. So that's great. So I'll show you what I mean by that when we do a full path. What are your thoughts on using the 755 filter for SR and lavender for burn? Never lavender for burn. This happened once, actually. Somebody used, an office used lavender for burn, and it was a disaster. They ended up with blistering, so just be very safe. Ice, hydrocortisone's awesome, and I wouldn't do anything else. The 755 for SR, I mean, it's a high water peak, but with the 755, because it was made for dark skin, you don't have the ability to build heat on a lighter skin type very easily. The 580 you do. So I'm more so 580.
Hi, Cara.
Hi.
Hi, can I ask a question? Hi, Deirdre from Dublin.
Yeah, of course.
Hi. So you're patch testing, yeah? So
yeah.
When you do the full treatment, you obviously don't retreat over where you've just treated.
I do.
You do?
The only, because those areas didn't respond and they're not holding heat. Because they're not holding heat, then it's safe to go over it. The only place I'm not going to go over is where I found
where you got the response.
Yep.
Okay, cool. Cool.
Okay, so now put some gel here. I'm going to pull out my mirror so I see what I'm doing, and then I'm not going over that area that's already stingy. And we'll show the full thing. All right, I got to pull this down. Sorry, guys. Nothing you guys haven't seen before. That's what's great about this industry. You don't have to really apologize for that. It's normal. We're usually half undressed with these treatments. All right. Hair out of the way. Get this down just a bit because it's creeping up. Let me get my mirror here. That's the, okay, so I want you guys to be able to see, plus I want to be able to see, so let's see how we can do this. I'll hold the mirror down here. Okay, you can see now, perfect. All right, so just very slight pressure. Get my foot pedal, there we go. Oh, by the way, I'm not going to do the full chest quite yet because I like to do a build on heat test. So I'm just going to finish this row to make sure I'm actually safe and assess what is the build on heat going to be like, because maybe it was fine just 3 spots here, but now when I go to do a full row, maybe it is too much. So you guys, this is a disaster. I have gel everywhere. I have a broken mirror. The didactic webinars are so easy. I was just thinking, oh, this could be a breeze. Oh, it's working. Okay, so see the redness now. That's why poikiloderma is pretty scary to treat, because it turns so red because it's all vascular. And some people may look at that and go, oof, that's too much. But it's based on what I'm feeling. Is it too much for me or your patient? Are they saying it is hot? Then yeah. If they're saying it's, nah, it's just a little bit and you feel it, it's warm. But if it was a burn, like it would be really hot to the touch. I mean, I've seen burns where they tried to ice them and the ice packs were melting. So the skin would really feel really hot. But we'll just wait a second here. Anybody have a question while we're just waiting a second? You guys can see that nice and red. Would you share which foundation you have on? Sure. So I have 2. I have very, very, very oily skin. So it's not the best for everyone, because if you're dry, it's not going to be great. But if you're oily like me, it's Christian Dior, and it is Forever Flawless Skin, something like that. And I mixed it today with Estee Lauder. I can't remember the name of it. It's their most popular foundation, and it comes in like 50 or 60 colors. So whichever Estee Lauder's most popular foundation, that's the one it is. So I mixed the 2. And the reason why I mixed the 2 is the Estee Lauder has a lot more coverage, where the Christian Dior is a bit lighter. So I mix them more coverage for the webinars. But like on a day-to-day basis, I just wear the Christian Dior one, just lighter. Do you use pressure with melasma? Well, yeah, usually. I mean, melasma also has a vascular component to it, and that's why we can get great results. Is there's a lot of pigment, but there's also vascular. But it's so much pigment that we're usually targeting that to keep them comfortable. Yeah, I usually use just kind of solid pressure in that area. All right, so redness is definitely lasting. I would tell you guys that it was about a heat level of a 3, if even. It's more of a stinging with some mild heat. Probably doesn't look like that, but that's what it is. All right, so now we'll finish it so we can see the whole chest and what it looks like. Okay, here we go. Let me figure this out again. Let me hold the mirror. All right, this is right about where I left off. Let's see. So you guys can see. There we go. Oops, foot pedal. I don't know why I forget that. Your overlap, by the way, is going to be much tighter than you think. Because there's a lot of plastic surrounding the light guide, in the beginning, you're probably going to gap too much. And you're going to be tighter than you initially really thought. So keep those pulses really nice and tight just so you get a great overlap. Okay. Ooh, I'm going to get close to the camera to see if you can see the capillaries because they're angry. I hate poikiloderma. I've always wanted this gone, but if you guys know me, like personally, if we've met in person, you know that I travel extensively for Viora, so I don't always have time for this. I rarely have time for this. So, happy that we're doing it right now. I don't have any dates coming up, that's for sure. So it's okay to have a bit of downtime right now. Okay, so I just did 2 rows there, and I'm going to come down. I'm going to avoid that mole of mine here. It's not a fake mole, it's a real one. I'll move around it. Oh, sorry, I'm not in camera. And then that's about where I left off. It's not really warm anymore. I'm just going to go over it again. All right. So you know what? See, I don't want to show too much here on camera, but I have some pigment down here. Let me just hit it really quick and see if I can show you guys if it darkens in the endpoint right there. Honestly, you would probably think by looking at me right now that I have a lot of heat. I mean, it's like nothing. It's crazy. Let me hit these really quick, and then I gotta be careful because I'm wearing black. I don't want to get this on my black shirt and burn it. Okay, so we'll see if those darken. So I can show you guys, but let me wipe off the gel and I'll get a bit closer to the camera so you guys can really see this endpoint. I mean, honestly, I think the next time I do it, I could even be all the way down to 10 milliseconds. I'm at 11 milliseconds now, but next time if I were your patient, next time I came in, I'd probably do 10 milliseconds because I really don't feel much. I mean, I feel a little. Otherwise, I would have kept going up, but it's not bad at all. Okay. Let me hang up the handpiece and then I'll show you guys. Use this piece of gauze here so I don't have to get another one. So we can see kind of some things turning here, all of this for sure. This is cool over here. So when I get off the camera, when we say goodbye, what I would do right now, I just don't want this to be like too boring, is I would go, these are areas of warmth and redness, these areas are not. I would probably go back over this. So and I'd go back over this. So that's when it's, you know, safe to do a second pass. I wouldn't pass over this again, but I could hit this again. So when I pop off, I'll probably hit that again, just because there's not much heat. Let's see in our chat here. Okay, am confused, as redness on your chest should be lesser with IPL as it would cause vasoconstriction of the capillaries. Kindly explain. Sure. So, I mean, in the end, that's what we're wanting, is not so much vasoconstriction. So, I mean, that's something that we could potentially do if we're using like pressure, right? Constrict them. But it's more with an IPL, we do want less redness for sure. And that's our end goal, is to be able to coagulate the vascular lesions enough for them to collapse, and then, you know, it go through that process of phagocytosis where then our body gets rid of them because we've killed them in a sense, you know, coagulated them, necrosis and death to them. But before that, it's always going to look worse before it looks better, because heat, and the heat is what's getting us to that coagulated necrosis point of the vascular lesion. So your endpoint with vascular, with pigment, is always darkening and always heat and redness, because we're using light-based technology. And it goes back to that principle of selective photothermolysis. Photo meaning light, thermo meaning heat, lysis meaning destruction. So at first you're going to have heat, and the heat is what destroys the vascular lesions. So that's why there's going to be even more redness until it then starts to calm down, and then the actual coagulated vascular lesions are going to be a bit darker and look a bit worse. But then as the body starts to get rid of them, then everything starts to look better. So same with like pigmentation. We go in there and we shatter it, we break it up, but it darkens. And then it starts to look like little coffee grounds. And then after about a week on the face, then they're gone. So it's always going to have redness. They're always going to look darker because we're getting to that coagulated point, and then they'll start to fade away. I hope that makes sense. Okay, I don't see the workbook for IPL on the website. Are you able to direct me where I can find it? Sure. So it's myviora.com. You go to the customer portal. By the way, this is just for the US customers. If you're overseas, just disregard this. If you want the workbook, then you can contact your distributor and then they can send it over. If you are the distributor and you don't have it, then you can contact Viora. But for the US customers, it's myviora.com. You'll click on the customer portal. You'll choose the VSP, Viora Support Program. I think that's what it stands for. Then you'll click on whichever device you own. If it's the V20, you'll click on the V20. And then you'll click on the handpiece files. When you click on the handpiece files, then you'll click on the IPL clinical files. And then all the IPL clinical material will be in there. Okay, I had a patient with melasma and it made it worse. Can you advise? Yeah, absolutely. What about Canada? If you live in Canada, then you would just contact your distributor, and your distributor can send over all the materials. Okay, and it made it worse. Absolutely. That's the #1 thing with light-based technologies and melasma, is that they will make them worse. So you always have to prep the skin beforehand. I went into really great detail on this with the IPL didactic webinar, where they would need to wear a topical melanin inhibitor morning and night for 2 to 4 weeks. I recommend 4 weeks before you ever go in to treat the melasma. And what that melanin inhibitor topical product is doing is it's telling those melanocytes to calm down, kind of back off a bit, and you can go in with light to break up that melasma, kind of shatter it, without it backfiring and turning even darker or getting even larger. And then they would stay on that melanin inhibitor throughout their whole course of treatment. To be extra safe, have them wear that morning and night for 4 weeks, then go in and just do a test spot on the area. Make sure it's going to be safe, and then you can do the full treatments. If you want more detail on that, if you go to Viora Online Academy, I go through different ingredients, different skincare lines, and that's on the recorded webinar from last week, I think. I don't know, I'm getting so confused now with all the days and weeks and webinars, but you'll find it there. Any other questions? Appreciate your passion. You are fabulous. Love every session. Thank you so much. Thank you, thank you, thank you. I'm glad that you loved this one too. I was a little worried, like, how's this gonna go with me treating myself with the social distancing? So I'll just show you guys one last time that redness. And there's about a heat of, I'd say 3. Some of these pigmented lesions are darkening here. There's one right there. Let me see if I can show you guys. Oh! So you can see the pigment here darkened as well. I was thinking, like, will we be able to do, I don't know if I'll really be able to do like great hair removal on the camera, just because it's really hard to show you guys my leg. I don't think you guys will really be able to see the endpoint. I don't think it's worth it. I'll talk about it though for a second, and then I'll open it up to questions. So for hair removal, your endpoint is going to be the same thing, this kind of redness, this kind of sensation, kind of a stingy heat. That's how I would describe it. Some people describe it differently. And seeing the redness there, seeing the change. But your change with hair, there's going to be 2 things. One, it's going to be more little red dots because each hair follicle is inflamed. So it's similar to like the capillaries and the pigment. With the capillaries, the redness is surrounding them and you can see they're kind of angry. With hair, you can see the hair follicles are angry because of the heat and it's holding on heat. So you'll see these little red dots. If you don't get that perfect endpoint, because sometimes you just don't, then your endpoint is going to be, the biggest one is the smell of burnt hair. And you're going to test them just like I did with my chest. Same thing. First, work your energy. Get to the point where the skin starts to become red and hold on to some heat. And if you're now, the skin is holding on to heat, but you don't smell burnt hair, then you start dropping your pulse duration one at a time, testing each time. And then as soon as you get to that strong smell of burnt hair without them feeling too much heat, minimal heat, then you are at that perfect parameter. So that's another endpoint, the smell of burnt hair, the overall redness, them saying that they feel some mild heat. And then a lot of times they can get those red dots, but an hour after they've left you. So, they start to see it later. Sometimes it's immediate. Let's see, we got a question here. Let's see, what are your thoughts on V-form and HR? Oh, that's fine on the same session, totally fine. Do your V-form first and then go in with your IPL. Absolutely, you can do that. Okay, you guys, well, have a great day. Hopefully I'll see you later with Cocktails with Kara. Hopefully you'll have a cocktail in hand. We're gonna have a cocktail recipe too, so you can go out and buy the ingredients to make a new cocktail. But Viora loves you guys. You are our Viora family, and we will continue supporting you. And stay safe, stay healthy, and of course, stay inside, unless you need to go to the grocery store for your cocktail ingredients. And I'll see you guys next week. Well, hopefully today, but then next week for the other webinars. Bye-bye.